This conference will now be recorded.
And they must have disturbed her nest because she came back again the next
I
day.
set reminders in my alarm clock.
But then I killed one before we left her about 3 weeks ago. It was that long.
That'd be a bummer.
He was
Just
mad.
last
man,
like
when I
minute,
pulled
I mean,
that
it's like, just
board up.
try not to. There we go.
You don't pull boards up this way.
No. Yeah.
Please stand for the Pledge of Allegiance and a moment of silence.
Pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Item number 1 on the agenda is consider approval of consent agenda items.
Madam Mayor, I make a motion to approve the consent agenda as presented.
A second.
We have a motion and a second. Will the clerk please call roll?
Bishop,
Yes.
Mawat,
Yes.
Shriver,
Yes.
Scott,
Yes.
Adams.
Yes.
Item number 2, requests or comments from the public. All right, moving on to number 3 here, presentation from the Wyandotte County Public Health Department regarding ARPA funded programs.
Well, I got the health department, Thank you. Yeah, well, we appreciate the invite here tonight. I think it was Mike who got the conversation started on this conversation, maybe with Kathleen, our CFO at the Unified Government. We get some emails passed and forth, back and forth. But so I'm Wesley McCain. I serve with the Public Health Department, manage the finances and manage some of our public policy work. And I'm joined here by my colleague, Colleen Kelly, and she manages our ARPA funds. The health department received $10 million in ARPA funds. The Unified Government overall received $88 million. The health department, and so this presentation is a presentation to talk about the funding we received, and then we have started to roll out projects both to fight COVID. A portion of the funds was to fight COVID, and then there's also parts of the American Rescue Plan, which is focused on the social and economic recovery as well from COVID. And so we kind of talk about some different parts of that. So, and I can push this right here. Excellent, nice. We presented Bonner Springs 2 weeks ago, and they did not have this. So. Real quick, just a quick overview here. We're going to focus on the health department projects. The Unified Government received a lot of funding that's not dedicated to us, so we're just going to focus on our department. We're going to talk about some projects. Oh, I'm sorry, we did not update this slide. It's not benefiting Bonner Springs, it's benefiting Edwardsville. I'm sorry for that. And so, and then we're going to look a little bit to some that we're about to roll out, and then we'll have some time for questions and discussion. So just real quick, I'm going to give a quick overview of the overall ARPA Act. So the Board of Commissioners of the Unified Government has set 3 high-level goals for our pandemic recovery. The health department has a little bit in each of one, but we'll focus obviously more on the community health and well-being component of these goals. So a little bit about ARPA. You've probably heard a lot about this. I know along with the unified government receiving funds, the cities of Bonner Springs and Edwardsville also got funding, and so your staff have probably talked to you some about this. But ARPA was this huge act that was passed in March of 2021, $1.9 trillion. The part of the funding that the cities and counties and states received is a smaller part of that, and it's called the state and local fiscal recovery funds. And those are the ways that those monies can be spent is pretty broad, but it can't be spent on anything. And so you can see in white here are the different categories that are in the act that we can spend the money on. And ours for the public health department are in the top 3. There's things on the 4 and 5 that other parts of the UG are spending money on as well. But you can see we dedicated a lot of the resources to that first box here. Public health, we just have to run vaccine sites and do testing and do mass comms to residents, do handout tests, handout masks, all of that. But then we also have components of projects that are in the second and third box as well. And I will talk about that here in just a little bit. The other thing I want to mention is that you, in addition to not being able to spend it on anything, you can't spend it on anyone either. Yeah, they have certain categories of people in the act that in order to receive services or be a target of any of the programs, you have to have been impacted by COVID. And they, in order to make it easy on this, they define that in these sort of various ways. And the easiest one is being low to moderate income. And the way that they define moderate is up to about 300% of the poverty line. So most of the programs that we talk about tonight, they're eligible for people anywhere from the lowest of incomes up to that moderate income range. And that is about moderate. I don't have the figures right here for what that is, but I think it's, don't quote me 100% on this, but it may be 60,000 for a family of 4 or something like that. So it really is up kind of to that median household range. And so now, with that intro done, I'm going to pass it off to my colleague, Colleen.
Thanks, Wes. We're really happy to be here tonight to share with you the past and current projects that have had not only CARES Act money, but ARPA funding applied to them. So first, we're going to talk about mobile vaccinations as well as overall vaccinations. And you'll see on the screen those in the Edwardsville community that received that mobile effort or were benefited from our mobile units coming out. And that occurred at events and businesses, as well as at-home visits for those that couldn't come to one of our mass mobile vaccination sites. Next is our mask distribution effort. And when we had more information around the efficacy of masks and needing a KN95 to prevent more transmission, then we made an effort to work with our emergency management department that had a huge surplus of masks. And these are the ones that came out to the western part of the county. And let me go back just a second. So our current efforts that are not listed on here are at-home tests. So Kay Sharp, our community engagement officer, is working with some of the same partners that she worked with on this mask distribution effort. So if you know of partners that would like to work with her to get those tests out to the community here, feel free to let us know and we'll connect you and get those folks working on that effort to get more tests out to the community. Then the next project that was highlighted was our home delivery of supplies, and that included PPE. If people were infected and concerned about going to the grocery store, we delivered food and cleaning supplies, and that was been throughout the pandemic up until today, actually, that we're still been putting out those efforts. And people in Bonner and Edwardsville both received those supplies, and they just usually left them on their doorstep. And here's a picture of our mass fac site out at Kmart. I don't know how many of you toured that site or were part of that effort, but that was our first mass vaccination site. And then the second site was out at the old Best Buy at the Legends. And then the third site was at the Armory towards downtown. And at the height of our vaccination efforts, we were doing 1,000 people per day at each site. So it was a huge effort that a lot of people were a part of, and a lot of people worked really hard on. So the next project I'd like to highlight is the Transportation Assistance Program. That was ongoing throughout the pandemic and is still ongoing. We are still working with the UG Transit on streamlining that process and creating efficacy around how do we get that information out to the public more. And people can get rides to the grocery store, or they can get rides to work or a medical appointment that, or to the health department if they would like to get services there, like our WIC clients and other efforts that we have ongoing at the health department. The next project is one that has actually just been launched, and that's our substance abuse project. I don't know how many of you have watched the news lately and the overwhelming issue around opiate and fentanyl exposure. And so we are working to get more Narcan distribution, both in law enforcement and in our schools. And so she's really working on programming around that and then hoping to launch that in the next month or so. But she's been outreaching to folks about providing more of those doses of Narcan to try and address that issue. And then, as I previously mentioned, there's WIC, which is Women, Infants, and Children. And we do have clients in Edwardsville that are part of the WIC program. And our ARPA-funded projects around WIC are around breastfeeding supplies, bottles, needs that young mothers need. And so if they come in for an appointment at the health department, they can use the transportation program to get there, and then they can get bags and supplies through this program. They also are passing out some of those supplies at diaper days, if you've heard of that effort with Happy Bottoms. The next project that I'll highlight, and the last one I'll have before turning it back over to Wes, is our health education team. So they are frequently out at Bonner Springs Farmers Market, but they also are, the next thing is the Wyandotte County Fair. I'm not sure the fair dates, but I know it's like soon, right? So they're going to be out there with the booth and educating people not only about COVID, but other health issues. And we're hoping that folks can understand that there's not really a shame factor in the education team. It's more about just sharing information and letting people make their own decisions. So with that, I'm going to turn it back over to Wes. That's going to talk about projects that may not be ARPA funded, but that are still affecting Edwardsville and Bonner.
So have any of you heard of our CHIP? Anyone here heard of the health department's CHIP or the Wyandotte County CHIP? No?
Only related years ago to real estate. Like there was a CHIPS program for housing in
Oh.
non-developed, not non-developed, but in lower promoted areas or marketed areas. That
Okay.
was also called CHIP.
Interesting.
I assume that's separate than.
It is, yeah,
Okay.
it is. There's also health insurance, the children's health insurance program. Sometimes people confuse it with that. In the public health world, at least, we've been trying to spread it into other sectors slowly. We call our CHIP our Community Health Improvement Plan, and it's the health department's biggest initiative, planning effort to decide with lots and lots of stakeholders what the highest priority issues and projects are for us to tackle over the next 5 years in order to improve long-term health outcomes. And so we have, and it's for our whole county. It's for KCK, Bonner, and Edwardsville. And the way it works is we have what the health department did this time is we in the data collection for that effort, we had we sent out surveys, we had a lot of people engage in it. We looked at interview responses and also secondary data, and really took a turn towards what's called the social determinants of health on this. And it's really what emerged in our conversations about how we were gonna, there's been a lot of health problems in Wyandotte County for a long time. I think it's been in the news for a long time. A lot of you have probably seen the press about that. And the way that we move those health factors is by looking at sort of deeper health issues. And you can see the issues here that emerged in our 2018 plan. Jobs and Ed, which is really focused on access to higher paying jobs, really want to get people access to those jobs that that will help them bring in more income into their home, healthcare access, safe and affordable housing, and violence prevention. And the way that we do this work, because the health department, I mean, the health department does not do we're not experts in these areas. So instead of us staffing up at our agencies and trying to bring on more people, we identified lead agencies in each of these areas, and then we've resourced them. We help with planning. We help with some data if they want to make a case about things, and then we help to connect them with government resources. So if you, oh, I'm used to saying next slide. So our ARPA dollars were provided for the lead agencies who run that initiative, and then also for some projects as well, which I'll touch on right here. So another transportation project, you might see a couple transportation projects in here. There's 3 actually. In people accessing services, accessing healthcare, that comes up as one of the biggest barriers. People talk about the lack of transportation to places a lot, which is why we focus on it a lot. And we have a project that's half funded by the Kansas Department of Transportation and half funded by ARPA. And we've partnered with safety net clinics in Wyandotte County. And we're going to be providing free door-to-door transportation for any resident of Wyandotte County to a safety net clinic appointment. And so it's non-emergency medical transportation. So it's not ambulance care. It's basically anything else. That project's going to launch in about a month, and we're really excited about it. Next one, I think you all had a recent presentation about this. Very proud this actually started as a CHIP project. Several years ago, the Economic Development Council of Wyandotte County took a trip out here, I think a couple trips to talk to the business roundtable here, and had a lot of conversations about transportation, and lots of different things happened. There's many people involved. CHIP's just one partner, but we were very engaged in helping to put people together to start the conversation. And then I think ARPA as well made some funding available for this transit route to develop. And so you can see here pretty soon, there's a lot of partners. I should mention our friends from the UG Department of Transportation. They've worked hard on writing the grant request, getting the funding in on this. But we're really excited to be able to provide another link for people to come to Edwardsville to work. And do other things as well. And so one other program, we have a business ESL program. Language access is a big reason why people whose English language skills are not good enough for supervisory work or being a foreman or getting a higher paid job. We found a lot of success, well, some preliminary success in establishing business ESL programs on site at workplaces. So the business provides the location, and they pay for the individuals to get the instruction while it's happening. And then we provide the instructor for free and the structure for it. And we have done it at 3 businesses now, and it's actually working really well. The businesses really like it. They value their employees being able to be developed. It's great for the employees, and it's a win-win-win. So we don't have any Edwardsville businesses signed up, but if you know any businesses that have workers whose English is not their primary language, we're actively recruiting to expand on this. And then our last one here is one, a big project that we kicked off, which we added funding to this to make sure that it covered Western Wyandotte. Health workers, speaking of access will come up a lot, but if you look at this blue box here, community health workers are they're like social workers, but they have a lot less training, and they don't function in kind of the official capacity that social workers often do. They help people who have a difficult time accessing healthcare, accessing government services, accessing educational services, navigate all those. So oftentimes it's language. A huge one is language. People are here, they don't understand how things work, and they need some assistance from someone who speaks their language. Another one is disability status. There's also people who just have a lot of health issues. So they're really, really, really helpful, and they help make government more efficient. They help people get where they need to go. It's a shame to make programs and then not have the people who need them the most access those programs. So it's really, really cool. And we were able to leverage some funding from a grant that was just for Kansas City, Kansas, to add a couple health workers to serve Bonner and Edwardsville. And they are still doing that. And so that said, I'm gonna kick it back to Colleen.
So I'm between you and a break, I assume, so we'll get through the next few slides relatively easily, I hope. So what's on deck? We talked to you about what has been occurring, what's being launched currently, and then what's on deck is low-income legal assistance for all of Wyandotte County citizens, and that includes anything from rent negotiating, landlord disputes, and anything to do with any kind of legal assistance. The RFP process through procurement has already gone through, and Kansas Legal Services is going to do part of that work. And then we're working with community partners on what the other needs of that piece would be. And we hope to get that launched this fall. Something that we find really exciting is the mobile grocer effort. Again, that's been through the RFP process. It's gone through procurement. It should be published either this week or next. And then we'll get bids on hopefully providing mobile grocery access to all parts of Wyandotte County, coming out to events out here as well as other parts of the county. So people who don't have an ease of getting food stability can have access to that service. One of the things that's a little bit longer in the timeline is the mobile medical clinic. So we're in the process of trying to figure out logistics for that, equipment for that. Obviously, I don't know how many of you have been downtown to our building, but the overhang of the parking garage has turned out to be a problem for us in getting equipment for this effort. And so we hope to get people out in these mobile medical clinics for school vaccinations. We've talked to Bonner about school physicals possibly, but just being able to provide not just COVID vaccinations, but other efforts in regards to mobile medical needs. And then as we continue to roll out our projects, just for an FYI, I don't know how many of you are aware about the UG application process for ARPA projects. That deadline was about a week and a half ago. They received, I think, over 172 applications and 80 some odd million in requests with a $16 million pot. Our projects are a little bit separate than that. We've been working for a good 6 months or so on our projects. So that's a different pot of money, but we, as the part of the ARPA funding that is the health department, are always looking for ways to get the message out to all of our constituents, including Western Wyandotte County. So if you have ideas about how we can get the word out more, we'd be open to hearing them and connecting you with the people that are in charge of those efforts. After we met with Bonner, we've connected folks on doing our community health assessment out at the Bonner civic space because they couldn't find something at the library. Our team couldn't. And then so they actually helped us facilitate a new space so that we could make sure that we get input from the western part of the county, not just western KCK, but far west is Bonner and Edwardsville. So we'd be happy to connect you with our comms team in multiple languages to try and get that message out for all these projects that we've highlighted. So at this point, we're open to questions. If we don't have the answer, we're happy to go get it for you and send you an email back. But Wes, you want to join me? And you guys have any questions?
I'll ask just a little bit. When over the last year and a half or so, a lot of questions that I'd received from constituents, and one concern that we have ongoing in Edwardsville is we pay a lot in county taxes. As much as we get the same mill levy as everyone else in the county, yet it's really hard to see what we get in return for those funds. And that's probably a lot of what our city manager is communicating and having y'all come out and give us a presentation. Every single county service we receive, we have to drive to Kansas City, Kansas to access. And so looking at the mobile grocer, mobile medical clinic, those would be, I think, really, really beneficial to the people of Edwardsville if they're coming to downtown Edwardsville, where people without transportation would be able to access. But in the same thought process of where is our money going, what is it used for, we saw a lot of billboard advertising and things like that, and they're going, really, couldn't that be money used to help people instead of every other billboard's a COVID ad? You know, we know where the things are, the marketing's come across, but there was just a lot of money that went through the health department. When we're looking at the UG County funds, it was 32 million, 16, half of it's going straight to the health department. And so I think a lot of questions that folks have in Edwardsville, and thank you, I know this is not an easy place to stand on this side of the conversation, is just where's that money going aside from just Kansas City, Kansas? And when we're looking at low income legal assistance, how does that help the health of the people in Edwardsville? I guess that would be my first question, is low income legal assistance. How does the health department spend money on legal assistance? How does that help the actual health of people in Edwardsville?
That's a good question. That's a very good question. And so and you asked two questions. The first one was about the finances of the county and the ARPA funds and things. I can look up. I know a lot about the 10 million we received, and can talk and look and answer any questions. As far as the larger amount and the county things, I'll have to I can grab information and shoot that to you. It's there's a larger pot of money that I don't manage, but would be happy to get any kind of info on it. You know, one of the things about the American Rescue Plan Act, it matches up really closely and well with the items that we have in our CHIP, our health improvement plan. And one of the things that we've found in a lot of our issues, like around health, is that you have to have, I mean, I mentioned the social determinants of health. People sort of health is like built on like a foundation. So there's kind of two things, which is, one of them is sort of like, does health have a, you know, what does legal assistance support and not being legal problems like have to do with your health? And the other one is like, why is the health department doing this? So we have, it has to do with health, a lot of, people who have, a lot of it is really linked to, I think, the issues that people have legal assistance about, which causes like increased like chaos and instability and problems in their lives. And those are the things that are connected to health. So things like people have there's a lot of landlord-tenant disputes that people get into. They get into employment issues. There's family issues where people have a lot of issues domestically, you know, things like that, where they're sort of caught in situations that threaten their employment, threaten their housing, threaten their family stability, sometimes with violence. You know, it depends on the situation. So it's one of those items that it helps in other areas of people's life that we know is connected to health, and those things can make a big difference. And I'll just tell you, the reason that it got put into our sort of stable of projects is we were talking all the partners that we have in our chip, we were asking them, what are the biggest issues that you're hearing from your clients, the people who you see at your healthcare agencies, the people who you see at your housing agencies? And they said a lot of our clients have legal problems. They come in and they need a lawyer. They've got some kind of issue. And so that was the basis of it. So it'd be interesting. I'd like to kind of look and see if there's any data or anything that I can send you that kind of shows the links, because I can say it, but I'm sure if you're like me, you're wondering about that. But that's how we kind of view it.
And
And
none of this is criminal legal.
no, it's not. No, it's not. It's not. It's for civil matters. Yeah, we don't dip into that.
Well, and just to address your question specifically about billboards,
Mm.
most of those are funded from KHE, and then the feds also had certain jurisdictions that had low vaccination rates, and they have drop fees and additional funding coming into those communities, and unfortunately, we were one of them. But I don't know of us ever spending money on a billboard.
I'm sure we probably have actually.
Well, I'm
Yeah.
happy to get the breakdown for you, but I was on the KHE call twice a week, and those billboards that I saw, the digital ones, those were all there.
Okay, so even though it was branded Unified Government of Wyandotte County, the money was not coming through the county.
I'd have to double check. I
Okay,
don't want to misspeak.
Sure.
And I'm happy to follow up with that.
okay,
But like I said, I was on those KHE calls twice a week,
yeah.
and they were making those, the majority of billboard buys that I saw.
And I think, you mentioned the transport, that was one of the reasons, that's one of the reasons why we came out tonight. Cause I know there's a lot of, Edwardsville is spatially away from where we have our building and where City Hall is. There's more services, I think, concentrated in that area. So we have a lot of projects that we're rolling out with ARPA funds that will be really helpful for residents in Edwardsville. And we want the mobile medical clinic is one right off the bat. I hope you and your colleagues are thinking about where in Edwardsville. We don't have that scheduled out yet, and that's something we're excited about because we don't have another location for our health department, and that's going to allow us to do services in different places. So knowing where we can put that here or near here, the grocer, obviously, a lot of the services too are, we'd like to know how to reach your residents with, because there will be things that with the transportation assistance, especially, and with we could look at some of them. Some of them we don't know exactly where they're being established. So the legal assistance project, I'm not sure where they're going to office yet, but those are kind of things that we want to make sure residents in Edwardsville have access to. And I think sometimes, along with the spatial thing, it's like the information doesn't flow as well, right? Because we might have our channels and you have your channels, and they're like little cities, and we have our city and stuff. And so being able to share and connect on that is really important. And so we put that in the slide. That's really, I do either now or in an email later or in some exchanges, would like to kind of know the best ways to get information out to your residents, because that's a really important part of, we're going to roll this out, but if we don't have a way to get it out to you all, it's not as helpful.
And I actually just got phone calls this week again about, well, why don't we have a grocery store in Edwardsville? And it's something that we can't, you can't put a developer. We've had grocery stores, that's a private business decision. But when you look at the food deserts and putting grocery stores as they have in Kansas City, Kansas, and you look at the distance between our folks in Edwardsville and the nearest grocery store, it'd be hard pressed to make the case that we're not just as far away from groceries. And so that mobile option, I think, would be a great benefit to us. So we'll keep in touch on that. And then just when we thought of when we were talking about the legal thing, I saw something come across in one of the ARPA online meetings, and I thought it was health department, but it might not be. Was there anything for wiping out criminal records or helping on the criminal side or getting rid of tickets or expunging records associated with the health department with ARPA, or was that just the UG and ARPA funds?
That was one I think we did send some emails about. There is the court, the KCK court has a project where they're working with Kansas Legal Services on people who have a suspended driver's license. They wanted to try to bring people in and get them into like a diversion program so they can get them reinstated, because there's a lot of people who don't have the resources for it. And so that's something they're doing. And then the health department, it's not funded by ARPA, except that ARPA funds go to support the kind of main agency that helps to coordinate it. But they, we have a clean slate initiative that we've been working on, and it's the same thing. We started with, you know, people, in order for people to live healthy lives, they have to have kind of a base level of household income. That's a really important part of health in general. And so the biggest barrier, one of the biggest barriers to that was people not being able to get living wage jobs, and working. And a big barrier for that was having a criminal record. And so that's kind of how we worked our way into that issue. And we're working on that issue. We're trying to figure out how to make that process automatic. There's the laws right now are fine in Kansas for that. Honestly, they're, you know, you have to be three years for certain offenses, 5 years for others. But it's a pretty cumbersome process. So we've been working on that project. But as far as it's not, we don't, there's not like a big ARPA funding thing for it, but that is the space that we're in.
So our county budgeted funds are going toward that, to helping people in Kansas City, Kansas eliminate their criminal record?
No, that was, thank you. That was actually something that we had accidentally used county funds for. And then we got a question on it from someone in Edwardsville. I thought it was you, Mike, but maybe not. And said, hey, what's going on with this? And we said, oh, sorry, because we were partnering with the court on that. And so then the commission was like, well, let's allocate the funding to the health department. And then there was a question, hey, what about Bonner or Edwardsville? And would say, oh, this is just for the city. Okay, well, it needs to not be county side. So that there was some confusion about that. We made a mistake.
Okay. Well, and,
Yeah.
and I didn't actually know about that, but about the mistake. But it just, another concern that we have in the county is being unified. A lot of those funds get in a really gray area. And so it's important, I think, just for policy sake moving forward, just to make sure if something's really benefiting the people of Kansas City, Kansas primarily or only, that we're not pulling money from the entire county just to benefit Kansas City, Kansas.
Right.
If that makes sense.
It
And then
does.
the other part of that is I really believe in second chances, and that's fantastic, but just making sure we're protecting the victims on the other side of that too, that if someone's breaking the law, that we're not removing all consequences for that, because in Wyandotte County, repeat offenders are a really big issue. It's a revolving door. And so I'm making sure that we have consequences and we're protecting the people on the other side of that, so we're not having car accidents with no insurance. I mean, that's how you get your license suspended. You ram into a car, you don't have insurance. Now this person's out of a car and out of probably work for a while, but we're working to get the other guy the license back.
Yeah.
And so just protecting our citizens on that front as well. And I won't take all your time. I'm
Oh,
sure
that
other
makes sense.
people up here have questions or comments as well.
Yeah. Thank you.
I do. You know, everybody in this room knows that once the federal or the government starts a program, it never ends. So what are your plans when all this money runs out? Is the UG going to take care of it and then raise our taxes? I mean, that some of these things sound okay, but you know, everything never ends with the government. Never.
Yeah. That's a good observation. We have already started fundraising for some of the items in this. We added a grant writer on our staff this last year. It was one of the first things that we talked about when we were being allocated these funds, was we're adding some projects in here, and it's worse sometimes. I mean, it's helpful while it's happening, but it's worse sometimes to start something, people get used to it, and it's helping people, and then it's gone. So we don't want that to happen. And we don't have answers for all of the programs and projects that we're rolling out, but we have started searching for funding. We've put in a request for some projects like already to either expand them. Now we have funding for 3 years in a lot of this. That's one nice thing about the federal program. All these projects are going to go through the end of 2024. So we do have some time to fundraise, but that's a huge part of it. And there is, I mean, and I'm sure probably any government person would say this about their department, but the public health has not been funded super well, just across the country. I think that was one of the big problems when COVID hit. We didn't have a lot of the tracking and control infrastructure to help stop the virus and roll out vaccines and testing as quick as we would have liked. And so a portion of it will be requested through the unified government. I don't know what that'll be, but it'll be a combination of strategies to make sure that we don't put an undue burden on taxpayers. But we'd really like to raise as much funding from the private sector as possible. There's foundations that pay for health. Federal money. I mean, I'm always thinking, why burden Wyandotte County taxpayers when we can burden other taxpayers in other places and bring resources to Wyandotte County? I think that's important. So we're thinking about that. I think it's going to be a combination. I can't speak to the tax raising, obviously, but yeah, it's one of the first things that we thought about when we got the money.
All right, we'll see you in 3 years. Let us know.
Okay.
Okay.
We'd like to come back sooner than that, actually, to update you on some of the stuff we're doing.
So on slide number 5, you put in one of the ways it's spent is facility repair. What is that, and can you give me some examples of facility repairs that have been done?
The first 3 are the health department's jurisdiction. The bottom is the facility repair, I believe. Maybe I'm mistaken.
It's it. It's in the, I think the first or the second one down, if I'm not mistaken.
Oh, do you have that? I'm almost there, I guess.
Yeah,
Oh, is that what it is?
Oh, the infrastructure.
There you go. It's actually bullet number 3 on the first public health.
Interesting. Facilities repairs. I don't see that these are eligible uses. So as far as the public health dollars, we inhabited an old Kmart for a vaccination site, and we inhabited a armory. The Kmart was from 1960. The armory was from, I think, the 40s. We did have to repair some of those buildings. I know the building, I don't know, it leaked. Some things happened. I don't want to, yeah, there were some issues with those buildings. So we did repair the mass vaccine sites. I think those are the only buildings that the health department has used funding for under this. I think there might be other buildings that other parts of the unified government are using or maybe plan to use ARPA funding for. That wasn't a huge expense of ours. This is like a category that you can, if you want, spend the money on.
I believe the general just for that broad category, one of the things we did was to ensure that the safety around people in our facilities. So
Okay.
double entrance doors or barriers and screens, those kind of
Okay.
things that were done for living, so that you have safe work.
Okay.
Broadly, I can't typically do part of it, but that's what that.
So you mentioned safety net locations.
Mm-hmm.
Could you define what a safety net location is and where they are located?
Yeah, sure. Yeah, sorry. Yeah, a safety net clinic is a healthcare clinic that is for people who are uninsured or underinsured, I guess, and for whatever reason don't want or can't visit a hospital. And so we have, I don't know, maybe 7 or 8 of them in Wyandotte County. Some of the bigger ones you may have heard of, Swope Healthcare Services is one of them. There's one at 65th and Leavenworth, or there was. There's one down at 12th in Minnesota, or 12th and Central. Vibrant Healthcare Clinics is another one. They've got 3 locations. They're all kind of around downtown area.
So there's nothing in Western Wyandotte County.
You know, that's a good question. I don't think that there are any safety net clinics. I would love, instead of me saying that, we should check and make sure. That is actually an issue. And I think that's one of the things that with the mobile medical clinic thing, that's one reason that we're pretty enthusiastic about that, because I think there is a big swath of the county where if people need healthcare and have a difficult time getting it for cost or whatever, they don't always have a place to go.
And what,
I will say those programs are federally recognized as part of the funding mechanisms of how they get money reimbursed, that take Medicare. So not just any, I guess they go through whatever that process is. A community, one of those community health providers, they do that, but it's not automatic. So Providence Hospital is not necessarily created, and they do require some federal certification. Don't know the process.
so this mobile medical clinic, are we talking about on a bus that travels around? Or are we talking about rotating doctors through different hard locations in different places, or what's that consist of?
It will be a vehicle. We have gone back and forth between something that's like a big RV with a medical clinic inside and a specialized trailer that has a clinic in it. But it is going to be a traveling vehicle. We'll have doctors or nurses or both inside, along with an exam room, and it'll be a place for people to be seen. So yeah, it's an actual. It's nice because we don't have to then go somewhere, because you don't. It cuts down on your ability to see places when you have to have all that equipment on site. So yeah, it's the full deal.
Okay, and the attorneys that you use for the legal services, what's the pool you draw from, and are they compensated for their work, or is it pro bono?
We did an RFP for that. We had to do an RFP to bid it competitively, and Kansas Legal Services was the group that bid on that. And for part of it, we might have to do another one for another part of the project. But it'll be attorneys with them. It would have been a difficult. We'll have to see if there's an opportunity to build upon that somehow. But it would have been difficult for this project to kind of do it in a way where we would have used a lot of people from different places. We wanted to get one agency to kind of help to coordinate it.
So they're compensated for their service.
Yes, yeah, they are.
These are wonderful programs, and I'm a little remiss. I maybe didn't know about a few of these. How are all of these advertised?
So we do a range of. We have a lot of different ways that we do that. Social media. We really like making flyers, so we often, if there's a program, we'll make a flyer. We'll try and spread it out. Email networks, social media. If it's a project that has some marketing dollars to it, then we can get a little more ambitious. We have a little bit more comms money now because of ARPA, and so we've been doing more on radio and
Do you
things
do
like
any
that.
mailings? Ever done any mailings for any of these? Edwardsville, we've got the communication is, with no newspaper.
Yeah.
we have social media, but I just don't know if everybody knows about these programs personally.
We have done before. Yeah.
Mailings to
Yeah.
everybody,
Yeah, we have. And that's,
even these newer programs and. Even if somebody has they don't get the paper mail,
You know, I don't know if they do an electronic push.
I wonder.
same information, But the comms team also, like just recently when we went to Bonham, the comm folks there wanted to be added onto the press release list. So we can do the same for anyone that would be interested in Edwardsville. That way you would hear about these programs as they roll out. But we are happy to connect you with our comms team to develop a strategy specific to Edwardsville. Everybody, specifically when they knew that we were coming out here on our team, both from the comms team and community engagement, said, ask them how we can get the word out there.
right?
So they are interested and passionate about serving the community. So any ideas you have, please email them to myself and I'll connect you with them.
Thank you so much. Personally, I think sending it to their house in the mail is the way you're going to reach everybody, but we'll have to collectively think of something. We will give you that information. Thank you.
Yeah, it's an interesting idea. I wonder, it'd be cool to send out one with a list of, yeah. Because there's several, I mean, there are, new programs for people that didn't exist three years ago. So it'd be interesting to do something that kind of alerts people to the new stuff.
So I see that there's 2 full-time community health workers that were, I guess, brought on new for Western Wyandotte County. Is that correct?
Yeah.
And if I'm reading this right, one of them is going to be in Bonner Springs for 8 hours a week. Right?
Yeah. That person has been there. Doing that.
Is there a possibility, and I don't know if we have space or what here in Edwardsville, but I think it'd be nice for our community if we had somebody scheduled, or one of these people, one of the two, 4 hours, 5 hours, depending on the need, for Edwardsville. And then Zach, he does a great job in advertising social media. He puts out our city newsletter and informs people, our citizens. I think that'd be beneficial in getting that information out than if they know that they have a social worker or health worker here that, for their service or for their guidance, and they can come and see them, and then they can learn and teach our citizens about what's out there for them, what kind of help. I think all communities are struggling right now with the drug abuse and different things. And so just knowing now that our city staff and our police and fire know what's out there, and if we knew we had a health worker again that's coming to our area, they could really just give that information, say, we've got somebody here that'll be here on Tuesday from 12 to 5 or 12 to 4 or whatever, or if it's something urgent. I don't know if your transportation service could take our citizens to Bonner or wherever to a health worker. I think that'd be beneficial for everybody involved, I think. At least it is to me.
And we have had some discussions about that when we learned that there was going to be this dedicated kind of person in this part. And I don't know exactly that. I know there was some discussion about that.
Yeah, we
Where
had a
those
discussion
were
with
at.
the individual, I can't recall his name, but actually Bonner Springs reached out to us, and let us know about the opportunity. And I wasn't aware that they had already started at Bonner Springs, but that was kind of where we left it, was like, once you get kind of your schedule set at where you're going to be, and how much you can be on the western part of the county, reach back out, we'll definitely fit you in. So we'll re-engage that person who we talked to a couple months back.
I just think it'd be beneficial for everybody, all of our citizens. And Mike, I think you only use half of your desk on the other side.
Get all the papers out of the way first.
It'd be really beneficial, again, for our officers and our police officers and fire guys that are out there in the community talking with our people, our citizens, and seeing people in distress, and they can make that, that first attempt, that first approach. The other thing I want to add, and this is all great, I'm glad that you guys are here letting us know what's going on and that we can inform our citizens. But a few years ago, there at this Kansas Speedway, and it wasn't Kansas Speedway that did it, but it was, we hosted the facility or hosted the event, but it was dental care. It was free dental care to Wyandotte
I
County.
remember that.
It was, I'd never seen so many people take advantage of that, and it was incredible. And it was a 2-day event, and we did it 2 different times. So I don't know if I didn't see that mentioned in your future,
Mhm.
but, you know, when we talk about training people and getting them the education to get better jobs, believe it or not, you know, if somebody has you know, horrible teeth or
I know.
bad teeth or,
Yeah.
you know, getting that fixed and getting that burden off of them and getting it taken care of, especially if they don't have insurance, talk about a huge morale booster for them
Yeah.
to try to improve themselves. So if that's a possibility, something that you could add,
That's interesting. That's an interesting idea. Yeah.
it was huge. Thousands of people.
I remember that.
I think it's been 7 years since I've seen that here in our area. 7 or 8 years, maybe.
Yeah. 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 The amount of demand that's pent up from that.
Yeah.
I mean, that speaks volumes that it's so busy, you know? So that's a really, really good idea.
On the 2 workers that are Western Wyandotte, so we know where one is 8 hours a week. Where are the other 72?
Oh, I think, I'm not sure. Actually, they work out of an office at 8th and Armstrong. I don't know if, I would have to find out on that.
So I know that even currently, Brian, who does that through CHC, had said that they're still knocking doors and still doing that. So we could try to pinpoint that more, but I know they're still trying to do canvassing around health issues, letting people know they're available.
Absolutely.
Yeah, if you'd get back to us on that, that would be great, especially with all the initiatives y'all are taking in getting services and just the knowledge of services in this part, to know where those folks are available would be fantastic.
And I don't, and I want to make sure I'm correct. So they're not employees of Wyandotte County, right? They work for the health council.
That's right. Yeah, that's right.
But it's
Yeah.
a funded program.
It's a small amount of ARPA funds. It's weird. The funding source actually was a HUD. It was a HUD COVID funding source. Isn't that interesting? Yeah. But yeah. They are not. They're not, but you know, we provide them a lot of money, so they take our suggestions well. Yeah,
So-
for sure.
So when
for
they're
sure.
door knocking, what information are they collecting?
They're not really collecting information, they're just usually saying things like questions around vaccinations, or do you have questions around quarantine if you're infected. At least during COVID, that's what they were saying. And then they will connect them if they're having housing challenges. They will connect them with services. If even at the door to door, we've had lots of stories of people opening the door and then saying they don't have any food, and so then we put them through that food request that's up on the screen and then get them out a box of food. So it's really kind of just a facilitator to be a stopgap measure for whatever they're facing right now.
I think that's the challenge, is just getting the word out there, what services you guys you provide. And so if they are door knocking, I mean, I think we can all find about COVID in our community, but it's, you know, again, I go back to drug abuse and anything else that they may need, health questions, you know, that, I think that's important to add to a flyer or a conversation. You know, if they're door knocking, please spend a week in Edwardsville and
And they
spread the word.
specifically did door knocking if there was like an event out here. again, this is COVID era and we are pivoting, trying to encompass all of the health needs. But they specifically would create flyers with our comms team around that event that would be happening in Edwardsville.
I think, Zach, for us, anytime we have any kind of community event, I think they need to be included in everything that we do, from the food pantry that was done a while back and hugely attended and successful, just to get that awareness out there. And then do your magic on your text.
The only other thing I would say, one, thank you for coming this evening. I was involved pretty heavily during the COVID thing and on a lot of those same calls, and I'm still amazed at all the things that are going on today. I think our probably biggest engagement has been around what's being done by Wyandotte EDC. So this issue of kind of that livable wage and increasing wages, has been on their radar for some time. It's been very active in our community because of the type of distribution facilities and some of the things that we have. So I know they've been working on that, and Wyandotte tends to be interesting because when you look on a per capita basis, we rank really high, but when you come to household income, it's not necessarily the same.
Right.
And because of the medical center, right? So when you pull in total wages, annual wages, and take it and divide it by the number of people who live here, that number gets heavily inflated, but yet we know that's not real world. And so a lot of the discussions about transit came around from our business group. We can talk about the roundtable. Those are done twice a year. We're engaged with those. Our mayors have always been part of that. Staff's been part of that. And that really was seen as an issue. It really is it's a one that's kind of, I don't want to call it a trial, because it really isn't. But other people are looking at how that's going to work in other parts of even this region and other regions, because they have the same issue, right? Transportation, and then quite honestly, childcare, quality childcare that can meet standards, right? And we know in-home childcare facilities cannot carry the load, but it's very difficult to get private care facilities that are affordable. So there's kind of that in between. And so you're working at one of our facilities specifically, and you're making $15, $16 an hour, and you've got to pay daycare, and where can I do it? Where can I take them? And then try to work right with it. That's a challenge that's been ongoing that I know Wyandotte EDC is focused on as part of this CHIP program, but even before that, and it's still ongoing. I think they've done a good job of helping get that part of the word out there. And we have seen an increase in average wages in our workplaces, which also tends to increase the ability to have health insurance. I was part of another program, and a lady who was in transitional housing worked at one of the facilities here, and she made the comment that her wage was a little less, but they provided 100% health care. She wasn't leaving because that was such a critical part. I mean, she was a single mother with 2 kids with no housing. That was literally her situation. And so I think all of these programs help us achieve those, and sometimes it's a little bit here and a little bit there and a little bit there. But yeah, I know they've been working. These programs are new in some respects, but as they noticed, this is from 2018 got started, which was well before the pandemic. It just made it worse or more visible or exacerbated or whatever the right words are. So,
Well, and
thank you for
we
what you
can send you that information when it's finalized, but Bonner folks, like I told you, President held the focus groups for the community health assessment. And we've been going back and forth on emails, and the latest email today was trying to settle on August 2nd as an opportunity for those folks in Western Wyandotte County to go out and look what their needs are. So once that gets finalized with the room number and all of that, I'm happy to email Zach or whomever to get that message out to you and encourage folks to go and have their voice be heard.
Thank you. Just to sum up, as you guys are wrapping it up, one thing that had come up over COVID, and I know ARPA we're kind of past COVID, but you never know what's going to happen next. And so I think that we've learned and seen that the mental health crisis has grown exponentially. Opioid and fentanyl use has gone through the roof. And a lot of that, I believe, came from the root of isolating folks, masking and isolating. And so I feel like it's so important that when we're putting restrictions out there from our health department or recommendations from our health department, that those are as narrowly scoped as possible and limited. And that's something that came up in Edwardsville a couple of times. Is we tried to get stats for Edwardsville and that wasn't given to us. They said, well, we can't release that to you. It's just here's sections of Wyandotte County and we were grouped in with everybody else. Well, you're part, it was never isolated to Edwardsville. And so I think just keeping that spirit and moving forward, like keeping those as limited and narrowly scoped as possible, and then moving forward, keeping those cities unique, because we have unique demographics and unique characteristics and unique statistics even when it came to COVID. And so I know as we move forward, that was looked at more and that was really appreciated. And then what you said earlier about, hey, we recognize that this is really helping the people of Kansas City, Kansas, and not the whole county. To me, that was like, oh, that was fantastic that somebody else within the county is seeing that and going, you know what, this is just helping this group. This needs to be funded by this group. That means a lot to us that's visible to you guys. So I really appreciate that. Thank you again for coming out. Again, I know being in the hot box isn't always fun because you don't know what questions are going to come forward. And you're going, well,
Yeah.
We'll get back to you on some things, but it's really appreciated. And thank you for coming out tonight.
Thank you all, for having us. Appreciate it. Yeah.
All right, item number 4, consider authorizing the use of special sales tax funds for the matching requirement related to the acquisition of a UTV slide-in firefighting unit.
As the chief comes up, he can give you more details about the unit and its purpose. Primarily, the reason this is on here is because in our policy, right, when we set up a special sales tax fund, part of that policy said that when we use these particular funds, that generally speaking, they would come to the council. As far as a purchase, it doesn't need to typically be a council required item, but we try to keep that up. So primarily it's here because it's a special sales tax expenditure, but the chief can give you more information about the grant that funded this.
Mayor, council members, good evening. As the city manager just summarized, in short, we are asking to fund $9,000 for a slide-in unit for the UTV that is owned by Parks and Rec. That is being paid for by Forest Service funds that is distributed through the Kansas Forest Service. This will be our 5th year receiving grant funds from the Forestry Service. The previous 4 years have been used to buy personal protective equipment for wildland firefighting, small diameter wildland firefighting hoses, and other items that had always exceeded $2,000 to $3,000 of our side of the matching grant. This is a grant program administered by the U.S. Forest Service that is distributed to Kansas. It is for small rural organizations of 10,000 people or less in the community, which Edwardsville qualifies for. Again, it is a 50-50 matching grant, so we are responsible for 100% upfront. We fill out the paperwork, send it back into the Kansas Forest Service, and they reimburse the $4,500 out of the total $9,000 that is requested. We submitted for this grant back in December of last year, which is the typical time frame that we use to put the grant funding in. We were notified last week that we were awarded it. When we went out to create the grant and draft all of it, we solicited bids, and our bid come back from Weiss Fire and Safety Equipment in Salina, Kansas. Some former members or some of the older members on the council will remember that's where we bought the multi-purpose vehicle from back in 2016. They have been building wildland fire apparatus specifically here in Kansas and Salina for over 50 years. It's a family-owned business. They can retrofit a skid unit or a slide-in unit that'll fit the UTV that is owned by the Parks and Rec. It'll hold about 40 gallons of water, have its own self-sustained pump. Now, the benefit to this is, besides the fact that we burn off all the vegetation at the city park and Riverfront Park, we could utilize it if we had to mobilize it anywhere here in the district, if we had a fire. But the big unfunded benefit to this is it will also provide the Parks and Rec Department an ability to deliver some water to the ball diamonds and the soccer fields and everything else that is already down there in the park. So when we look at this grant as an overall purchase, yes, it was written underneath the fire department's aspect. Yes, we are going to use it as a fire department aspect and asset. The other asset that's not written on there is it serves not only the fire department, but also Parks and Rec and building our Parks and Rec program. As I said before, we went out to solicit the bid price. We come back at $9,000. That was the price we put in for the grant. At the 50-50 matching grant, we would be responsible for 4,500 of it. We would get 4,500 of it back from the federal government through Kansas after we paid the upfront cost. Our proposal to the council tonight is to go ahead and approve the funding out of the special sales tax fund to purchase the slide-in unit and authorize the city manager to enter into a contract to have this unit built in Salina, Kansas, in which we will go out and pick it up when they're done, start utilizing it and training on it this fall. It is about a 90-day build time right now because of the height of wildland fire season. And then, like I said, we will be back in front if we have any other problems that come up along the way. If anybody has any questions, I will entertain them at this time.
Hate to be real ignorant, but what's UTV stand for?
Yep, but they call it a utility terrain vehicle. So it's the two-door John Deere Gator that Parks and Rec bought 3 years ago to replace the Kawasaki mule.
Will that be stored at the fire department or?
It'll be
public?
stored down at Parks and Rec.
So will you guys have quick access to
We
it?
we
if
have
you
quick
need it?
access to everything in the park. I have a universal key if the normal design keys don't work. But because of location and ability, it would be easier to store it down there because when we do the majority of our burn offs, it starts and originates in the city park down there. For me to go down there, it takes 5 minutes for me to put it on a trailer, hook the trailer to the back of a truck and go from there.
Chief, who does our maintenance for that gas engine not to be on that pump?
Most of it's done by our individual guys. Captain Dave Sled does most of our small engine repairs. And if he cannot fix it, then we take it over to Coleman, over off of K7 by Grass Pad. Mr. Ledgerwood, who used to be up at the Boy Scout camp, is the main small engine guy over there now with Coleman.
I'd like to make the motion that we purchase the UTV slide-in firefighting unit.
Second?
We have a motion and a second. Will the clerk please call roll?
Bishop,
Yes.
Malat,
Yes.
Shriver,
Yes.
Scott,
Yes.
Adams.
Yes.
Okay, item number 5 here, presentation regarding development of 2023 annual budget focusing on preliminary general fund, fiscal year 23 revenues and expenditures.
I believe Zach is going to handle the presentation for us this evening. We're ready for questions.
Yes, sir. Madam Mayor, members of council, we're just chugging right along with budget development throughout the summer, and we'll conclude. I mean, we've got a kind of a longer timeline due to the state changes as it relates to the budget process and the budget forms that they have, but we'd like to keep things as on track and moving at the same pace as we typically do, irrespective to those changes. So we're right on pace where we need to be at this time. Just again, to recap the critical success factors that we look at when developing this budget and previous budgets: communication, funding, growth and development, identifying opportunities, community leadership, ownership and engagement, and long-term planning. And those are the kind of tenets that we try to build our budgets around when we're pushing them or discussing them internally and then discussing them with you for the public. So let's give a quick update on 2023 general fund revenues. And this will also include a quick update on our how we think fiscal year 2022 is going to end up. So we're not going to get into all the nitty gritty individual major revenue sources. We do that throughout the year. The next time we'll do that, it's going to be at our August 8th meeting. which looks at current year performance. But in taking a 30,000 foot look at it, we're expecting to end the year at about $6.8 million. Sales taxes continue to come in strong. This includes kind of the tempered estimates for some of our court revenue. We'll continue to tweak these. These might be updated some by the time we meet again and discuss them in August. Looking at fiscal year 2023, so this is our estimate as of as most recent as we can get using the metrics that we've got, which again tries to outwardly project a year and a half of revenue while we're in the year prior. So with those limitations, we have done a fairly accurate job by the time we get to budget adoption as far as forecasting some of these revenues. And so what we're looking at right now is estimating ending the year at a little over $7 million or about 4% increase over where we think we're going to end the year in 2022. The couple metrics in there in the 2023 column that might shift a little bit, sales taxes, currently not being as bullish on that as some of the growth seems to be indicating, because economic factors out there seem to indicate that we might be coming into some kind of recession. So we don't want to, the last couple of years we've had pretty record growth in sales tax year after year. I don't want to continue to count on record sales tax growth. So we're trying to be responsible in our forecasting and not over promise and under deliver. We'd like to be on the other side of that equation. But all that to say, fiscal year 2022, that year end might change as we get more data, which might impact how I think fiscal year 2023 is going to go. So those numbers might shift a little bit. Let's see. Miscellaneous taxes, those are provided by the county via the state resources. So your motor vehicle taxes, your recreational taxes, things like that. This also includes the sale and miscellaneous revenue of a fire department vehicle and 3 police department vehicles, along with some other miscellaneous revenue built into there. It does not include right now some of the staffing grant revenue that's been discussed previously with this council, and we'll talk a little bit more about that as we continue to move on. So on the expenditure side of things, so real quick, get our heads around the general fund priorities as staff is looking at them and developing the budget to present to the city council. So on the staffing side of things, we want to integrate grant-funded public safety positions, some of which you've already been made aware of when the fire department came forth with a resolution requesting authorization to move forward with the staffing grant. That would cover 100% of 3 new personnel in the fire department for up to 3 years. Police department has a similar grant opportunity out there that they're working through, and we're waiting on award news for both of those grants. So right now our expenditures on the general fund side of things is kind of keeping that in mind. The police department grant would be reimbursed at up to 75% of the personnel costs, while the fire department grants would be reimbursed up to 100%. So obviously that's going to have some effect on the revenue side of things. It's going to offset some of those additional costs if those grants are to be awarded. I think it's a little bit imprecise on when we'll get news on award on that and how it relates to the actual budget adoption. But that's certainly one of the plates that's in the air that we're just watching and keeping you all informed as it affects both the revenue and the expenditure side. For compensation, we've got kind of a range of compensation options that we're looking at, and we'll get firmed up as we continue to move through the budget development process. The beginning of that range starts at our 3% step increases, so that moves through the pay plan as this council had previously approved of about a year and a half ago. So just keeps moving through that pay plan as has been, recommended through staff, and just to keep up with the metro and to keep up with wages, which with inflation being what it is, that's kind of becomes even more important. Facilities, most of the facility costs in the general fund budget are more maintenance based. Some of the larger projects, your public safety facilities, your public works facilities, some of the major improvements in parks, those are probably more appropriate to be discussed when the city manager gives his presentation about potential bonding capacity and the city's capacity for debt for some of those kind of large, big ticket items. So when we talk about facilities as it relates to the general fund, these are mostly, keeping things spruced up, some repairs at the community center, some repairs at the park, buildings and grounds, and emergency type purchases. Equipment, right now, the city manager is taking a look at statutory requirements for setting up a replacement fund. So that would be, again, not necessarily impacting the general fund, but as it relates to equipment, those are kind of the different mechanisms that we're looking at to make sure that we've got a good, steady funding mechanism to replace equipment when we need it and outwardly look at it when we think we're going to be needing new equipment. So that way we're not caught, unawares as to a break that's happened and we need to replace some kind of larger machine or equipment and not be prepared for it. And another one that we wanted to talk about was quality of life improvements as it relates to the general fund. So we've got some additional funding built into this for Parks and Rec programming. That would be sports and non-sports, and we'll continue to review that. We've got some additional facilities in basketball at the city park, which people are using. So we like to incorporate some programming around that. That's youth and adult programming. We've had some success recently with non-sports programming in the Parks and Rec and partnerships with the fire department specifically, who will share a little bit of details on the Junior Fire Academy. We've had a lot of success with our summer movie series. People are attending those pretty regularly, and some of the other just non-sports type recreation events that give folks in the area something local to do that the city can help promote, either through organizing it or even just using their facilities for it. And as always, we've got an increase built into the street maintenance expenditures in the general fund for this year. Last year was budgeted at $40,000. This year it's budgeted currently at $50,000. And again, those are not your major reconstruction projects. Those are your kind of run-of-the-mill maintenance projects that need to be done to roads from time to time. So taking payroll out of the equation, looking at these other areas of the budget, that second column, again, is where we think we will end up. We're projecting to end up from expenditures in these areas at the end of 2022. That's using data through May 2022, which is as updated data as I can get collectively. There's a little bit in there that spills over, but essentially a little less than half a year's worth of data, trying to extrapolate where we're going to end up in those different areas of contractual services, materials services, equipment, transfers, and capital outlay. And then in the third column is our estimate right now for general fund expenditures in those areas. And then the last column, you can see the percent changes that. As you can see, in total, if we look at that bottom row, we're actually projecting a little bit less of a little bit of a decrease in those areas outside of payroll from where we think we're going to end up at the end of this year. If you look at materials and services, that's the biggest decrease. The reason that number in 2022 is so large is that's the kind of category that captures buildings and grounds and just the general materials that departments need to run their operations. So building and grounds is one, fuel is one. So those two expense items, we just had a major repair for the city hall roof. We had a repair at the community center, and fuel is running at about 55% more expensive than it was at this point 43% more expensive at this point than it was last year. So, and that's in our public safety department, who obviously uses the most of the fuel. But all that to say, that shows a decrease because we're hoping that we return to kind of more normal levels than that. We're budgeting for that in fiscal year 2023. In total, again, budgeting a slight decrease in these areas of about 2% or about $20,000 from fiscal year 2022 to fiscal year 2023. Any questions on these expenditure levels before we move on? All right, seeing none. So in looking at the pay scenarios that we're going to be talking through later on as we go out through the summer. So as I mentioned, we've got kind of the range of pay scenarios that we're looking at starts at moving through the pay plan as the pay plan prescribes. So not being stagnant on that and moving through those steps as you're supposed to do to keep it up to date and to keep it in line with the other communities and the other private companies whose talent that we're looking to compete with. So that same staffing is 3% step adjustment per the city pay plan, no additional staffing. So this doesn't incorporate any of the grant. This is that far end of the scale assumes that we don't get any of the grant funding for the public safety departments. On the other end of the scale, the kind of where we're looking at the max, that would include the grant staffing. So 4 full-time new public safety department staff members. We're currently reviewing the possibility of an additional admin staff member who would serve as the official city clerk, as well as possibly a part-time intern who could help out with special projects, and then step and COLA adjustments up to 3% on both of those 2 metrics. So the difference between the low end of the scale and the high end of the scale is about $500,000. So obviously we want to get as much up-to-date revenue data as we can, so we can present you with a balanced budget respective to all these other revenue sources and the priorities that we want to accomplish within the general fund. Again, we got to remember, this is only talking about the general fund. Some of the larger ticket items that take up a lot of the discussion at this level don't necessarily involve general fund dollars. Those are those bigger ticket items that debt and bonding capacity the city manager will speak to in a presentation later on tonight. So a couple more general fund notes. Right now, this assumes no change in the mill levy. Our goal is to maintain 15-18% fund balance of general fund expenditures per the city's financial policy. Our other goal, obviously, to present a balanced budget. Our resources match our expenditure levels, while at the same time maintaining that fund balance at least 15%. Ideally, we'd like to keep it a little bit more than that 15%. 50% is the seal or the floor that we, shall not go below per the policy. Again, EPD and the fire department are awaiting an announcement for staffing. Some of that cost will be recouped by the grant funding that would hit the general fund. So it does have some, you'll see it hit the expenditure side, but you'll see a portion of it, a good portion of it, be offset by grant monies on the revenue side of things. Obviously, fuel cost is something that we're looking at. Fuel costs right now budgeted, right now we're assuming between the public safety departments, a 55% increase in the cost of fuel from fiscal year 2022 budget to fiscal year 2023 budget. And again, this doesn't include any potential ARPA funded projects. The city manager has put forth a number of grant applications for the county funds. The city has its own batch of ARPA funds for projects that we've not yet allocated. I think our priority at this point is to get through this budget process and then see what the county is going to award or not award, see what kind of grant opportunities the public safety departments are going to be able to be awarded. At the conclusion of that, then once we know where these other external funding sources are coming in and where we can allocate them, we can focus on the ARPA funds that were assigned to the city of Edwardsville and focus on other projects that those would be eligible for with respect to the other outside funding mechanisms that we've got that could go to these other places. So a quick update on where we think the fiscal year 2022 cash balance is going to sit. We started the year at a little less than 900,000. Right now with that 6.8 estimated revenue, the 6.6 expenditure number right there, that assumes a 2% overage. That's just to be safe that if we, if we typically, we showed those metrics earlier, we're typically between that, 3 to 5% where we're above the technical budgeted expenditure within the general fund. So assuming we get a 2% overage in the expenditure level for this year, that still adds to the fund balance and puts us at about 16% of the expenditures, which is right where we want to be with respect to the finance policy. We'll have a little bit, probably a firmer number to give you for the expenditures for the end of this year. Obviously, we've been dealing with a lot of high-level staff vacancies, a lot of frontline staff vacancies. So those are, once you go a couple months of nobody to pay, then that looks good on the balance sheet because you're not paying that money. Obviously, the work needs to get done, but at the end of the year, the benefit, I guess you could say, the silver lining to it is that it's money that we're not spending could contribute back to the fund balance and get us back to that 15 to 18% where we want to be. So for the schedule, we always end with this note. Next meeting, we'll talk more about the general fund, some of the other funds for fiscal year 2023 budget. August 8th, we'll give the mid-year budget report for 2022, which will update kind of where we think we're going to end up for fund balances at the end of the year. August 22nd, we'll set the maximum for the fiscal year 2023 and set the 2023 public hearing. We'll also hold the R&R public hearing, which was set via resolution at our last meeting. And then September 12th, we'll do the final public hearing and adoption. Again, we've got a little bit of a window outside of September 12th if we feel the discussion warrants it. But that's typically the schedule that we try to stay on year to year to get things nipped around that third quarter. So that's what we're looking at for the rest of the summer and into the fall. So if you have any questions, I would entertain those now.
I would just want to mention, when we're looking at the assessments, folks' property tax assessments have gone up nearly 10%. That should give us more than enough money to do some sort of a mill decrease. So I would appreciate, like, when, and I know this is a work in progress, but just to give us some options that include a mill decrease, since we have so much flexibility with a 10% jump in assessments and in revenue and the property taxes.
We're certainly going to look at and present to you a couple different options as it relates to the mill levy and how that final one will shake out.
Thank you. Okay, on to item number 6. Mike, are we still on?
Yeah, I think we should. I don't think we need more than 10 minutes maximum.
Okay.
And so I think if we could just take a quick 10-minute break for that and we'll come back and say something like this.
So item 6, consider recessing into executive session pursuant to KSA 75-4319B6 for the preliminary discussion of acquisition of real property.
So moved.
Second.
Returning at 7:45.
Second.
We have a motion and a second. Will the clerk please call roll?
Bishop,
Yes.
Malott,
Yes.
Shriver,
Yes.
Scott,
Yes.
Adams.
Yes.
This conference will now be recorded.
So we're on number 8, 7. You got it up for me? All right, thanks. As part of our kind of ongoing discussions about capital projects and financing of capital projects, whether those be roads, buildings, facilities, et cetera, the question came up, I think it was a reasonable question. So where do we fall out on our debt capacity? And some of this is going to look familiar because some of this is the information that we discussed at the council workshop, but kind of bringing it kind of up to date for you so we can start making some decisions around, how do we fund those projects we've talked about, right? It covers all of those from park stuff to buildings to public works facilities to, how do we continue to do our roads? Because as we said, even in the road projects, we don't have just an endless fund there, right? We are using some debt funding. We're using some special street funding. We're using some special sales tax, but all of those have limits to them. So we want to make sure we're thinking out to the future. So my point here is around debt capacity and not necessarily around general budget. So really the question again is, what is the city's capacity for debt? And that really has two separate answers, and I'm going to focus on one half, and the half I'm going to focus on what are the technical capacities. The other capacity is more the political capacity, right? Where does that fall? It's kind of like when we set financial policies, right? I mean, I can give you the technical pieces, but there's also kind of the public piece through the elected body. So I'm going to focus on the technical, and then we can talk about the other side of it. So kind of just starting with a little history here, outstanding debt. That's always a question. Will we have debt? Should we have debt? And how much debt do we have? Fundamentally, if you're not investing in your community, you're not going to have debt. And you really cannot fund on a cash go basis. Because by the time you collect enough cash, whatever you've had is falling down, falling apart, or the prices increase triple and whatever you thought you're going to pay for it. So debt is a reasonable debt is something that we use and we should use in our capacity as a governmental entity. We've been fairly level in our debt over the years. I just went back to 2016. You know, I didn't want to go back a lot farther because those debt issues have really come off the books. But we had debt issues in 2016, 2019, and 2020. So it kind of lets you see how those are impacted. So 2016, we're about 7.7 million. We peaked a little bit in 2020 because if you remember, we had a 2019 and then a 2020 debt issuance, predominantly for the 110th Street Riverview project. And we also put money aside for 98th Street. We put money aside for storm. We put some money aside for facilities. All of that occurred there in 2019, 2020. So you would expect these are outstanding debt. So that's what's on the books. By the time we get down the road here, 2022, we'll be at about 7.5 million. So roughly $1.5 million has come off the books in the past 2 years. The really big measure, the one that gets used by financial institutions, the Standards and Poor's, and those types of companies, our own financial advisors, there's a number of pieces they look at. But one of the big ones is your debt to assessed value. So you have this much assessed value, and then you have debt. Well, if your assessed value is falling and your debt's rising, that's generally a bad sign. If your assessed value is increasing and your debt's falling or even level, it's generally a good sign. But to give you, again, history over that same time, in 2016, remember our debt was about 7.7 million. We were at 14.9%. So our outstanding debt to the assessed value, total assessed value in the city was 14.9. In 2020, when we have $9 million outstanding in debt, our assessed value was about 12%. So even though we had more debt, our debt to assessed value actually had gone down. And if we look at the end of 2022, we know what we'll spend in principal payments, right? We know that going out for a long time. We're down at about 8.3%. So by end of year, our outstanding debt, which some of it gets paid down, and our current assessed value, so the assessed value we get in 22 for 23, puts us at 8.3%. And if you recall, during our workshop, many communities, 25, 35% is fairly typical. Most of the communities around us were in that range. We saw, I think, KCK, Unified Government was significantly higher than that. I don't remember the exact number, well over 50%. I believe Spring Hill was 70 or 80. I mean, it was significantly higher up there. And again, different situations may say that's okay. That's really what the Standard and Poor's people do. But they've always looked at us and we've always gotten a very high, we're at a double A minus, I believe at this point, from 15 years ago being unrated. So financially, as it relates to debt, we're in very good shape. We not only do we compete, we really blow our peers out of the water when it comes to these kind of ratios. So what does that tell us? Well,
Mike, can I?
Yes,
I'm
ma'am.
sorry, I have one.
Sure.
Can you go back to that slide?
Sure.
I'm just confused, just
Okay.
because. So that's 2022, that's 8.3%.
Right. So what it's saying
So that blue line looks like it's up to 12, or is that not supposed to line up?
the blue line is how much outstanding debt we have. I'll go back one more. So these blue lines
Okay.
transfer to the next page, and then I'm overlaying the assessed value.
I didn't understand it that
So-
way. Thank you.
By the end of 2022, we'll have just about $7.5 million in debt,
Makes sense now.
right?
Go on.
And
Yes. I
on
didn't read it that
$7.5
way.
million in debt,
Gotcha.
We have roughly $90 million in assessed value that will give you that 8.3%.
Perfect. Thank you.
And that ratio can be, you can look at last year's value to this year's debt, right? I did it to this year's value to year-end debt. So I'm looking at the end of year debt versus our ratio that we, because remember, we get valuation 2022. So we're in the 2022 tax year now, right? So we get a valuation. The final comes in November. The tax bill goes out in December. Those are your 2022 taxes. But for the city, it's a 2023 revenue event. So when I say 2022, that's what I'm talking about. That's when the valuation comes out. All right. So the other thing we know, again, these assume no changes in our debt, no issuance of our debt. We peaked out in about 2020 at just over $1.1 million. Today, we're setting in around 890,000. So that's what we actually write a check for every year. So that's what we got to pay for with that property tax dedicated to it. And as you can see, it rapidly declines till by the end of this planning period, 2039, or thereabouts. A little bit before that, you're down to 422,000, and it kind of goes down the last couple of years. Obviously, it drops off to zero. So we're looking at how much debt is outstanding, and we're looking at what's happening with our assessed valuations. And as we've talked about many times, our assessed valuations, especially over the next number of years, are impacted greatly by pilots. So those are payment in lieu of taxes, bringing those properties back on the tax roll as a full taxpayer. So I know you all know this, but I'll just restate it more for the public. So when we issue industrial revenue bonds, it effectively takes that property off the tax roll. It's 100%. We negotiate through that process and say, but you're going to pay a pilot payment in lieu of taxes equal to some amount, typically 50%. But I'm taking a piece of property, maybe it's paying $1,000 in taxes. We're issuing IRBs. We're exempting the new value, but they're paying 50% of the new value. So maybe they end up paying $200,000 or $300,000, $200,000, $150,000 in new payments. So you're giving up 50%, but you're gaining a significant amount of money. That's really the benefit of doing IRBs. And it was always it always worked well. That the new tax law, as we know, kind of messes that up because they don't give us any credit for IRBs. So part of the reason we go through the revenue neutral rate hearing is because we don't get any credit. But you can see even in the last 3 years, and I know with one of the things we talked about, that line is up over 3 years at about 9% a year. So values in this city, including pilots that have come on the tax roll, has grown by 9%. You then see a pretty rapid increase. So we ran this at 3 levels. We assumed that our values would grow at 5%, which is the yellow line, 3%, which is the orange line, 1%, which is the blue line. All right, so pick those numbers. In reality, we've exceeded those percentages probably just about every year in the last 5 or 6 years. Like every city, every entity, 2007, 8, 9 values were up. We saw a pretty rapid drop off from 10 through about 14. It was probably 2016, 17 before your values got back to what they were in 2007, 2008 height. So it wasn't just a 1-year blip as far as it was more of a valley, and that took about 8 years to go from high point down back up. So those last 3 or 4 years, people were saying, well, look at how fast the values are growing, but they were really just growing back to where they were 6, 8 years prior. But you can see pretty rapid growth in there. So what that shows, if I look back here at these lines, yellow, orange, blue, I'm taking the orange line, the one in the middle, 3%. And we would estimate by 2025, our $90 million of today will have grown to around $115 million. So we're going $90 million to $115 million, right? $25 million increase. If I go to 2030, 2035, 2040, you see those increases. And that's why you see that line really up to 2030 take pretty big increases, because we have 4 or 5 properties that are large ones whose IRBs are coming off, right? And so when those come off, it all comes to the tax roll. Now, the offsetting side is, right, you don't get those pilot revenues anymore. I get that. So you do lose that side of it. But it just gives you an idea of what happens to these properties as they grow. So then we look at assessed value and we look at debt. So what if we wanted to keep a debt ratio of 10%, very low, right? Well, in 2025, you could have 11.457 million of outstanding debt and you would still be at a 10% debt ratio. If you were 15%, you jump to 17, 25, right, almost 29 million. So you could have a debt ratio of 25%, which would be considered excellent in the finance world, and have $28.6 million in debt. I'm not suggesting that. I'm just giving you an idea of we have capacity to issue debt and the ability to pay for that. And even using these assessed values, right, you start going out even 1 year, you have capacity to pay, right? Every year we have to pay for our debt service. You could add another $300,000, $350,000 in the 23 budget for debt and not change the mill levy. So you keep your mill levy flat, you have another over $300,000 that you could be paying debt for. Now the question is, how do all those numbers work out? Well, that's a little hard to say, because if you asked me that 2 years ago when I did it, I could issue more debt. Why? Because interest rates are higher today than they were 2 years ago. So on a principal basis, I would have to say I got less debt that I can issue because I have to pay more in interest. But as we go forward, we can say, okay, we think that this costs this and this costs this and this costs this, or some things, and we can run debt ratios and we can run sample debt payments and plug them into our budgets and see exactly what it would do. But effectively, our debt service, as I said, is going down. So less of our mill levy is necessary for debt service. But by just holding that mill levy around where it's at, it's, I think, about 10.5 mills right now for debt service. If you keep it anywhere from 10 to 12 mills, you're in good shape to be able to issue debt to make improvements to the things we're talking about: roads, buildings, facilities, capital items, right? We can keep it in that range without additional burden to the taxpayers in the form of the mill levy. So, and again, I tried to keep this high level. I know these numbers can just get overbearing, but I'll say what I said at our workshop, which is we have the capacity and we need to invest in our community. And that means roads, parks, facilities, and the way to do it is through capital financing. So again, as I said at the very beginning, there's two questions here. There's the technical question: what my exact? I'm going to go back to the beginning. What is our capacity for debt? Technically, we have capacity for debt. Is it unlimited? Absolutely not. How much should that be? I mean, I think, again, you start looking at some of these ratios. You look at growth. I mean, even if you took even if you took a very conservative, a 1% growth in values, you still have excellent capacity to issue debt to make improvements to things in this community the way it should, in my opinion, the way it should be done. Right? That's where debt financing, long-term capitalized items. Don't spend debt on
a 1-year thing, right? That's not really what it's for. When you start getting into doing those things, I think is when you get into trouble. Right. And quite honestly, we go back to, 2007 when I showed up here, what were we doing? We went out and issued $5 million in debt, right? And we didn't have any money in the bank to pay for the day-to-day stuff. So what we were doing is we were taking debt financing, paying for those things. And at some point in the future, you got to pay for that debt, right? I mean, you go borrow money, people expect you to pay it back. You should pay it back. No reason you shouldn't pay it back, right? And so that's where we were at. We're so far away from those days. I don't even bring it up hardly anymore because that's just not where we're at, right? When we have the emergency items, that's what that $1 million reserve in your general fund's for, right? You have that reserve in your sewer fund. You have that reserve in it. That's when you have a problem. That's what that's for, right? Hailstorm comes through, knocks out all your police cars, assuming you couldn't get them covered with insurance. But, some catastrophic thing happens that's not expected. That's what reserves are for. That is not what capital funding is for. I'll just leave it at that. I can make other political statements, but I'll choose not to tonight. So.
Might you be able to look at the pilots that we have now in the pilot? It's easier for me to look at the actual amounts of money than projected percentages.
Right.
But to be able to see the pilots that are coming off and
Yep.
then what the actual property tax will be coming into the city.
Absolutely.
So that we can see like where that.
I got a big
money
spreadsheet like this, got 50 tabs that I can consolidate it down. And so every time we issue a pilot, right? And the last one we did was 2019. So all of our IRBs have been issued. That means, we approve them, but then they ultimately get approved by the state. They have to go through a process, at which point they're called closed and they get a number, right? So all of ours are closed. We don't have any in the pipeline right now, with the exception of a sales tax only pilot, which has no impact on property, right? I mean, they use the pilot for a sales tax exemption. It has no impact. We have one project that it potentially will come up on in the future on vacant land that they're looking to develop, but at this point it would be hearsay to even feel that that project is going to go somewhere. They're kind of in the talking phases, and I know y'all heard me say it a million times. When I can walk in the door and buy a product and take it with me, then it's a real project, right? When I can spend my money and get something in return, it's a real project. Up until that point, it's not a project. I mean, obviously you want to prepare for those, but after that. But I can. We have it broke down. So every year, every pilot, how much money we project it will generate to the city, right? Because again, the way, and this is an important thing on the mill levy. So the way pilots work is we negotiate an agreement and we say it's going to be $150,000 pilot this year. Typically we build a little bit of an escalator in them. 1.5% has been typical. We may upgrade that, but we build an escalator into that. That company pays that amount of money to the county with their taxes. And the way it gets allocated back is they take the total mill levy and they look at what percentage of the mill levy belongs to each entity. The city, the county, the school district, the community college, the library, missing something, I don't know, and takes it down. The challenge with that is where we've been pretty good stewards in lowering our mill levy, correct? The downside of that is every time we've lowered our mill levy and nobody else has changed their mill levy, we get less money out of the pilot because our percentage of the total mill goes down. And so we actually hurt ourselves in that sense. But that's the process. But if some other entity lowers theirs and we don't, then we benefit from it. So, it's just the law. It's not a way you're going to change it. But generally speaking, we have been between about 24.5 and 25.5 for the purposes of how much we get out of a pilot. So again, if we were looking at a $150,000 pilot, we're at what, 37.5 a year, right? And so that's what we do. We make some assumptions in there. We look at history and say, okay, we're going to use 24.5%, and we're going to carry that pilot out over each one of those over time. And each year we know what that amount is. That's how we know what to put in the budget.
And
And we'll-
typically when
so
those
it's
go
pretty good.
back on the tax rolls instead of pilot, are we getting more money annually or less money annually?
It really depends on how they value the project. And so that was one of the things we looked at in the past was, well, do we assume that if they're on the tax roll today, they still get valued? So the appraisal district still gives an appraisal. So they tell you what the appraised is. They don't tell you what the assessed amount is because it's assessed at zero, but the appraised. And so we watch those every year. They typically follow whatever the trend is in the market. So if commercial property is going 3%, they're upping those 3%. So when they come off a pilot and onto the tax roll, they are worth more than when they went on the pilot 10 years prior. Now, I will say, I've seen some, it's like, well, why did that one go down this year? And another one would go up, significantly more than the market. So it does fluctuate property by property, and we have to make some assumptions. But overall, I would say overall, whatever they were on the tax roll 10 years before and what they are now, they're higher now.
So generally the net income to the city from the county tax or the taxes, property taxes versus pilot, we would be getting more money
Yes.
the next year.
Yeah.
Okay.
In theory, it should be pretty close because, right, you're a percentage of the total taxes. So they're whether they're paying a pilot or they're paying taxes. But again, if the pilot's at 50%, when they come off, they're now, so if that pilot was $150,000, it meant that, and it was a 50% pilot, it meant they really should be paying $300,000 in taxes. So when it comes off a pilot, they're now paying $300,000. Of course, our $25,000 now is $75,000 in revenue. So right, our revenue doubled. And that's what's built into these projections.
And those are the numbers that would help me when we're looking
Sure.
at the payments, like our annual payment is
Right.
how much money do we have to make those payments with?
Right.
It just kind of, to me, it brings a little clarity.
Right. And I'm trying to, like I said, there's a big spreadsheet. Some people are into numbers, right? I'm into numbers. I like the numbers. I got to get into them, right? And others just would rather see the higher picture here. And so I'm trying to meet both of those, but happy to sit down and go through that more worksheet level. But again, I think the broad picture is you have capacity to issue debt for capital projects. How much? If you say we want to go issue $50 million in debt, I could go run all these ratios and I'm probably going to tell you, you know what, that's too much. That's going to put you at a 60%, debt to assessed value. I recommend against it, but not knowing what that is. And part of that is that's where, as we've talked about in the past, to get to some of those numbers, we're going to have to invest some dollars to understand what it is, right? When we build a road, we make some assumptions. Hey, roads cost, a mile of road is $2 million or $3 million or whatever we get. But as we go through the process, it gets tighter and tighter and tighter. So by the time we're ready to bid the road, right, we have a lot better number. So we often put a big contingency at the front end. By the time we get to the end, it's maybe 5%. We start with 20 or 30%. That's some of the hard part in there. The one item we know coming up probably will hit this year or early 23 is issuance of debt for 98th Street to match our part with the federal funding.
How much is that, Mike?
Probably 3 to 4 million. We the money that when we issued in 2019, collectively, we've set aside about $1 million for 98th Street to date, which has paid for all of the engineering and is paying for all of the right-of-way acquisition, should cover any utility relocations. Though so far, those are looking good. Typically, the utility companies have to do them, but if if they're on a private easement and we have to move them, then it comes to our cost. So we always have to look out for those. So we know where that'll be. So probably by September, we'll have a number that we can say, all right, we need to go issue this much in debt. There's no reason to get ahead of it. And so until we know what a bid letting date is, right, we don't need to get too far ahead of that. Now, obviously, when you issue debt, timing's a little bit of it, and it takes time, right? It's not something I can't call the guy tomorrow and say, hey, 2 weeks from now, we need to issue $4 million in debt. Can you get everything done? Well, no, because notices and all of those things. So we would have, I would typically say you want to have about a 90-day window in there. So by fall, we should be in a good place because the state will make us, again, on federal projects, we basically write a check to KDOT. KDOT takes that money plus the federal money, puts it into a project pot, expends the money. At the end, they do an audit and say, well, we spent more money, you owe us money, or we didn't spend all the money and you get some money back. And my experience is about 50-50. So we always leave a little bit of money in the project, just like 98th Street, right? It's technically closed with the exception of paying for water relocation costs, which I'm waiting for information from them. But we'll probably keep $200,000 in there in that project. So when we get the final audit, if there's money due, we're not scrambling to go, where do we come up with this money? Right? And generally it's small. I mean, generally it's less than 1% variation, but those things. So that's probably that one we know is coming up. Again, we issued 5-point-something million in 2019, 2020, and you saw what it did to the overall, our budget, which was negligible, right? It didn't really have any impact to us, right? Our mill levy, technically our debt mill levies come down a little bit because of how the system works, but fundamentally we've stayed right there at about 10.5 mils. So it's not like we brought in $5 million of debt and had to raise the mill levy double. It just doesn't happen, and it wouldn't in this case. So that's where we're at. Again, I can't speak to the latter half of that. I just can speak to the technical part of that. Is we do have capacity. We need to make some decision. I mean, I know we've talked about a lot of different things, how we want to proceed with those, how we want to end up determining what those costs are for a variety of projects. So then we can say, okay, how do we want to time those projects? How do we want to prioritize those projects? Right? Because some of that has a lot to do with keeping things level. I mean, I don't want to go out and issue. I mean, I may be able to issue $50 million over the next 20 years. I just don't want to issue $50 million year one, right? But I may issue 10 million and then 2 million and 8 million, and it just kind of depends where those timings are at. But kind of have to know what it is we want to do and get reasonable cost estimates. I'm sure we can all come up with estimates, but we want somebody has a little foundation.
And so to keep the train moving down the track,
Yes, sir.
we really need the engineers to look at a couple of the roads we've talked about that we know are going to be major projects and get some estimated costs in. We need to determine basically how we're going to approach a building project, on what method we're going to do it, and then be able to get some tighter numbers on it, so we really know what we're looking at. So this time it's anybody's wild, it's a wag on what all that stuff is. And so in order to keep the train moving down track, how would you recommend we move forward?
Well, we can get I mean, certainly relative to roads, I mean, we already kind of have our city engineer kind of laying out some what I'd call concept level planning, right? And put some dollars to that. I mean, again, that's a pretty big margin, in there. So we the outstanding, so the money we have outstanding right now, the debt, you're right. 4th Street was a big one, so that's now being wrapped up. So we'll see where those dollars come in. We have money set aside for property acquisition for public works. right, facility, and we've had some discussions about that. We have roughly a little less, I think, than $1 million related to police, fire, city facilities, right? Whatever that combination is, set aside really again for the design piece of it, right? I mean, unless we're gonna go buy separate property. 98th Street's probably the biggest chunk of those dollars. 110th is done, so that project is closed out. And we have money set aside for stormwater, and we have several projects we've kind of got in the hopper already. Mainly ones where we're replacing crossroad pipes. We have a lot of, I wouldn't call them bridges because that's not what they are. We have a lot of narrow crossings, right? So back in the day, it was a county road. It was 16 feet wide. They put maybe a 20-foot wide or an 18-foot wide box culvert in, and now you need more room on the road, and so you get these narrowing things. So we're looking at those. How do we, when we do them, go ahead and expand them out, make them 24, 28 feet long? People go, why are you making it so long? Because you want to put a road over the top of it. You don't want to go back and do that, those work twice. So that's really where we're at. We can kind of give a total project update, send that out to you, just where we're at. But I mean, the biggest one on facilities is how do we, and again, we talked about methods. So what method do we want to use out there? We talked about 3 general ones, right? We talked about traditional bid process where you go hire an architect, they put together bids, send them out, get a contractor, pick the low, somewhat, I say hope for the best. I'm not a big fan of that process. Then your second one is more the design build where you go pick a team, but they kind of, they go hire the contractors, they hire that. And the third one, kind of a little bit of a hybrid where you use construction manager. So you hire an expert, they're there with you when you hire your architect. So you got a team that's already working together, because sometimes that's not what happens. And as you put those bids out, you have a little more control over it. For example, if you want to, do more Wyandotte, you want to give, preference to local bidders, or you want to pre-qualify bidders. And I can tell you from being on a project where we didn't have that, and you get low, you get a low bidder, even under a design bid, and you get one bidder, one contractor that's bad, they can just destroy a whole project. So just have more control over it. My leaning has been, I think, towards that construction management. It maybe takes a little more time, but I think the good thing about it is you get more control over the project. I think at the end of the day, you get a better product generally. You're not going to save money. I mean, sometimes you'll hear, oh, use this method, it's going to save you a bunch of money. Lumber costs what lumber costs, steel costs what steel costs, right? Labor. I mean, if you're getting cheap labor, there's probably a reason you're getting cheap labor, and it's probably not what you want, right? I mean, you don't necessarily want to pay, top dollars for everything, but you have a little more control over it. And if that's something you don't want to do, I'd probably say, let's bring somebody in that really can speak to that, or go out to get RFQs,
Before we
I'm
get
just saying
too
that
far
would
down
be
the road
those,
on
yeah.
that, yeah,
Yeah.
I wanted to bring us back just a touch, and that is where we were going tonight, and finding out how much we actually can afford.
Right.
You go to a car dealership to look for a car, and if you tell the fellow that comes out, hey, I'm looking for a car, and he's gonna bring you right to the Lexus, right? Instead of saying, well, I can afford, this is our budget.
Right.
And so I think before we meet with builders, developers, we find out what is our budget, what can we actually afford? And that way we have a framework to keep our costs within what our budget can be healthy and afford. And so I think that's why before we get too far down the road on, when we will need to move forward on those, is get the dollars and cents of not just projections and percentages, but this is the available funds every year to pay the debt service. This is what we actually have. This is what the actual cost is going to be. And that way, before we bring third parties in, we know what we can afford.
Right.
And so I think that would be our next step before we get too far down the road on bringing the people in to do the construction management or that.
Sure. And again, I can bring more detail to this. That's just where I was trying to give the higher view. But again, some of that will be dependent. I mean, some of it is assumptions. And
Can you touch a little bit more on that, keeping the mill level versus lowering the mill? What kind of lowering the mill, what kind of, you said it had a negative impact. Can you?
Well, I was
explain a
talking
little
about
bit?
when you do pilots, so when you issue pilots, so when you issue IRBs and there's a pilot, payment in lieu of tax, right? So don't get this mixed up with BPU pilots, right, which is just a tax, right? That's a different story. But it is the way they allocate the dollars is based upon a percentage of your mill levy to the overall mill. So our mill levy is 173 total, right? And our mill levy is 42, I think, somewhere right in there. So that's our percentage. If the mill levy stays the same, but our portion goes down, then we would get less of those revenues from the pilot. It's just it's a percentage, and that's just how they calculate it, right? So, and when we do an IRB, it's for all taxing entities, right? So it covers everybody. The one exception now is on the school districts, which I don't think they have a capital fund, an 8 mil capital fund. That now comes out on IRBs. So TIFs are different, CIDs are different. So there's all these acronyms and things, but for the most part on IRBs, which is a tax abatement mechanism, that's where that's at. So,
And then one other thing I wanted to ask, and I guess I can, when do we lose Old Dominion? And what's that going to do?
as far as them relocating over there, the last I've heard is probably they are going to occupy their new facility this fall. But I don't know that they're leaving the one they have. I mean, we've reached out to them a few times, and they were in the position of they weren't putting it on the market yet. Now, I expect they will put it on the market.
Is that a concern for us?
At least talking with the EDC, and I don't disagree with them, that space probably will resell pretty quick. Now, they may choose to hold it and lease it too, which again, the property taxes, I mean, the property taxes are still there regardless of whether they occupy it or don't occupy it. There's taxes on the property.
So it won't be a big impact.
So can we go back to the number slide?
Go the other way. That one?
Yeah.
Okay.
So this tells us what our capacity is, depending on whether we want to go 10, 15, or 25%. And that's the political side you're talking about, is making a decision on, or really which percentage and are we looking at? And then that gives you the dollar number. But we don't know what the building costs. And we, it's if let's say we go 15 and we say we want to issue $25 million in debt, but the building is only 12, then it's an irrelevant discussion to talk about the 29 million or 25 million, whatever. So it's really without our cost at least narrowed down. I can't say we have any kind of discussion.
I can tell you it's going to be around $17.5 million for those buildings, for both those and City Hall, 3 of them.
Okay, well, and it would be great to have somebody say it.
Yeah, I just.
And a professional that we pay, that we can hold responsible. I trust you.
Yeah.
But we're not paying you to make that, and we are not holding you accountable for that number.
Ooh.
And so I want a number from somebody I can hold accountable for that number.
But this is just assessed growth. It's not what our payments are. It's not our payment that we're going out. It's just assessed growth, correct?
That's correct. So let me give it, here would probably be a reasonable example. So if today we're setting, we'll say for just ease, $8 million of outstanding debt. And that just stayed flat. So at 10%, what we would be saying is we have about $3.5 million of capacity of debt. In other words, we could have $3.5 million more debt on the books and still stay at that percentage. So we can run numbers based on those differences and say, and at that point, if I said, I want to be at these percentage, if I just took 10% and I say to our bond advisor, we're going to use these assessed values and we want to keep our debt ratios at 10%, how much debt can I issue over the period of time from 2020 to 2040? Is that what you're, I think?
Right,
kind of
that's
asking?
more of what I'm getting at is how much can we afford
Right.
before we bring in people to tell us
Sure.
how much are they gonna sell us?
And understand it, I mean, we can do it that way. You're always going to have some, just, all right, typical market volatilities, typical,
Sure.
will it actually grow at 3? What if it's 2% one year, 8% the next? I mean, there is some assumptions that you have to build into it, right? And you won't know it until you know it in that sense.
Right, but with debt falling off, that
Right.
opens up a specific amount of money
Right.
every year.
Right.
And then with the debt, we're assuming no more capital
Right.
until this. And so we'll have actual specific numbers that we
Right.
know are gonna fluctuate with debt falling off. And so that's more of what I'm getting at
Yeah.
is let's look at the debt that's actually coming off that opens up that annual amount of money.
And I have that number. I don't have it in this presentation. So for each year, that's what I was saying, even in 2023, if that mill levy's held, that debt mill levy, and there's no new debt, and I take that off, that gap would mean we could spend around $300,000 more in debt service payments. Now, how much does $300,000 buy you in debt?
Right.
There's a little variables in that, depending on what are the interest rates at the time you're issuing debt, right?
Right, but that
But-
is the kind of information I think
Right.
would be really beneficial is
That-
what
that we-
does
that we have.
300,000 look like?
Right.
What is our debt now, we know,
Right.
and what's our debt payment now? So that kind of
Right.
shows us where that
Yeah.
300,000 opens up, and then if we
Yeah.
need to do anything else with it,
Yeah.
it just kind of gives us a good picture in where we
Sure.
are right now.
Right.
Can we run down 2 tracks? Because we're going here and we got to stop this until we get this one. Can we run them parallel? And so we're not losing 6 months, 12 months, or whatever the number is. That's my concern is the longer we go at the present economic situation, the more expensive this project becomes. We've already made the project a couple $1 million more just by waiting the 2 years and because of the interest rate and the material costs. And so if we could run the tracks together so that when we have a decision, when we have a number over here, we're still moving ahead. So we're not jerking here and jerking here and jerking here and jerking here. And we're just running them together, getting the information so that when it becomes decision time, all of the information is we get it all at the same time. That's my concern is we run out here and do this and then this thing's back here lagging. And then we say, well, we need more information over here before we make a decision here. Run them parallel so you've got them at the same time.
I think always the first step should be just like and I know it's not the same as a household budget, but I think always the first step should be what can we afford and still be responsible and healthy in doing what we should with our taxpayer dollars and just doing the due diligence and not saying that needs to hold us up. Mike, you said you could probably get us that information pretty soon. And so I'm not suggesting making a big ordeal out of it, but just looking at okay, what can we afford? And then going ahead with those next steps. But I think just the same as we run our household budgets, and I know what our taxpayers would ask of us in that due diligence and saying, what can we afford before we pull the guys in to build these big projects? And I think we're already doing that with 98th Street and moving forward, correct, Mike, and getting the preliminary done on that.
Yeah, I mean, we're pretty solid we're pretty solid on 98th Street, what that debt issuance will have to be. Again, we always we give ourselves a little bit of a gap in there, right? I mean, you don't want to get down to the penny because things change, but yeah. That one we're probably pretty solid on.
If I understand right as well, right now our current assets value is less than 10%.
Correct.
Right, correct?
Yes, sir.
But you said is incredible compared to neighboring cities in our area, correct?
Correct.
And so I think looking at the numbers and wanting the numbers, I think the numbers will be exposed, I guess, or what that value would be once we, as a group, as a council, agrees if 10% is where we want to go, or 15%, which is still better than, most in the area. If we think 15% is an acceptable assessed value, then we know how much money we have to spend. Is that right?
Yes, sir. Yeah. And that assessed value ratio of those other communities was, so each year TML does a financial report on a number of items, right? And that's where those come from. So it's a little lag behind. I mean, it's always a little bit behind, right? We're more current because we've got our today numbers, but I mean, it's 12 months behind. But yeah, we can provide that easily.
Me just sitting here, just thinking about you saying how we're doing, how well we're doing, that's great. But as a community, we need to sit here and think about what we have for our community and what we have for our fire chief and our police chief and our facilities. And we don't have that. We don't have a place for them, a good place for them to be proud of, for us to be proud of. So if we need to, forego, that excellent rating that we've had, that less than 10%, and jump to 15% and still be completely better than most, and then we can afford, to have all the facilities that we can all be proud of, and our workers. I think we talked about that in the past. That, if our workers aren't happy with where they're working, what are they going to do? They're going to leave. And having appropriate facilities, vehicles, place to go to work every day, place for Zach and you to go to. I think that's what we need to look at. Is that a fair statement?
I think though, in that, and I think we're all working toward getting the much needed facilities and improvements in the city. We're still being better than most doesn't give us the actual dollars and cents of what does that mean to our taxpayers. And so first things
That's what we
first
need
is
to
just
know.
making sure that money's
know
there and available for us.
And again, have the information. I mean, there's all this pockets of information. And really, again, tonight was trying to partially answer this question, is there capacity? And I don't think there's any doubt that there's capacity.
And the great news is.
And
though,
how
is
much
that
of the
we're in a good
capacity,
spot for that.
well, how much of that capacity is acceptable or reasonable or you feel comfortable with, right? I mean, again, I worked in a community where we had a really high fund balance and we did do a lot of debt projects, but we had a scenario where we had two major taxpayers represented over 50% of our property tax revenue. So we took a whole different approach than I would do here because it only took one of them to leave, right? And those impacts are significant. And now your ratios don't go right. I mean, these were like each one had over $200 million of assets at the time. And I think the city was about 600 million. You take 200 million off, that same ratio without doing anything else goes from 15 to 75. So I think the caution is appropriate. I don't think, I think this is our number range if I kind of start drawing circles around it. And then it's kind of, well, where in there is the comfort level collectively through the council representing the public as to what that is. And we all know that, nobody likes to pay property taxes, not a single person in this room. Nobody wants to pay more property taxes. We know things cost more money though too. So how do you pay for them and how do you provide the services? So it's a delicate deal, but I think I have the information that I can get back to you because I'm pretty sure I know the number you want. And if we need to, we can sit down one-on-one too, but what that gap, what I call a gap, right? Each year, making some assumptions, how much money would be there. And then if I layer in and say, we're going to issue this much in 2022, and then in 2026, we're going to do this, in 2028 or 30 or whatever we want to space those out. our bond folks, Piper Jaffrey, who does our financial advising, they can run all the bond scenarios. They can fill a room with paper and bond scenarios, right? And then once you've got that, that really kind of tells you the impact on the, on your mill levy.
Right, and
'Cause-
similar to real estate
Right.
or,
Yeah.
just because we can get pre-approved up to a certain amount of money,
Sure.
doesn't mean we can afford to spend that much money or that we don't need reserves somewhere else. And
Yeah.
so just because we can fit in these ratios and
Yeah.
it's fantastic that we can, that means we've been responsible thus far to give us that ability. So
Right.
our credit score is great,
Right.
which is fantastic, but we don't necessarily want to spend every bit that we're pre-approved up to.
Correct.
And so I think that would be helpful, not only for me, but just for the general public and saying, okay, when we're looking at taking off this big bite of debt, that
Mhm.
we're in a good place to do it and we have the money to do it and it's not being done backwards.
Right.
So.
And I will say, and I'll just, even doing this chart, if you look at this one, the one I did say 3 or 4 years ago, right? I mean, it looks pretty much the same, but I'll tell you one change that happened when I'm looking at that gap, right? Is if you recall, we were taking 65 or 125,000 down to 65 out of our street fund and putting it over to our debt service fund, right? We don't do that anymore. So I took all that out of the equation, right? So obviously that impacts the mill levy in the sense or how much gap is there. So I've taken all that out too. So as I ran new numbers, but I can show all that to you. But anyways,
Thank you.
that's really what we wanted to get to, is just a broad spectrum. We'll get down deeper and go from there.
Thanks so much.
I
Mike,
keep
did you
wondering,
have,
I'm pushing the button, but Zach's back there, I think he's playing with my mind, so.
did you have anything else for us just in manager report?
Not on the manager's report. As you know, we had a discussion out of the executive session,
Okay.
but I just, I thought 9th Street would be open today. When I drove by, it was still closed. I did talk to them. The challenge is if they open it up, you can drive through there now. Once it's opened up, then anytime they're working within 25 feet, then they have to close it all down again. And you gotta then get the railroad to go set it all up. So that's mainly why they've left it, is they're still putting the bricks. Okay, they put the bricks, and the finalized, I was like, well, maybe everybody's looking, and I go, so, did you write a nasty letter? And I did half it all.
Can't read it.
Yeah, so so that's still there. We did have a sewer breakdown on, I think I said down on Wood End. It actually ended up being the business attachment there. So I spent a lot of time last week being public works director, and I wish I could tell you I have great news and found a competent replacement. But first I need to get good, competent, we've got competent, pretty small applicant pool, so we expanded to look out.
Yeah.
We did hire our new public works maintenance worker. So Sam, he'll be starting here next month. So he actually has municipal experience, so he's worked for a couple of cities in summertime, part-time work with some cities or seasonal work with cities. So he'll be a good asset.
That's good. Great to hear. So I need to bump us back up to item 5. No, I'm sorry, not item 5. Item 6. We just had some business to take care of from the executive session.
I'm on. Madam Mayor, I'd like to make a motion to authorize the mayor to negotiate and enter into an agreement for the acquisition of real property contingent on the subsequent acquisition of special additional real property.
Second.
We have a motion and a second. Will the clerk please call roll?
Bishop,
Yes.
Malat,
Yes.
Shriver,
Yes.
Scott,
Yes.
Adams.
Yes.
Thank you. Sorry
I
about
don't have
that.
anything unless there's other-
Okay, thank you so much. Ms. Dehan, did you have anything for us?
I read it.
Yeah.
All right, Chief Matthews. Chief Whittem.
As you can see, we dealt with 8 to 11-year-old charged today. There has been some scuttlebutt rumor running around. I want to remind everybody, this camp is not using taxpayer funded dollars. $2,500 fees for this camp came from our guys running the 5K Fastenal last year. That was a $2,500 community engagement grant. And then of the 45 applicants that we have, there was a fee of $35 per child paid to the city. So other than personnel costs, we have nothing invested in this activity. However, just food for thought, when we talk about how our community makeup is, this is the first group of 8 to 11-year-olds. I have 6 little boys in there and 10 little girls in there. My 17 age group next week is about the same percentile, and we are doing a double up third week of 8 to 11-year-olds because we looked up 16 spots and had almost 20 in a waiting line in 24 hours.
Wow.
So if you are presented by anybody in the community, says, why are we wasting all this money and this and that? There has not been taxpayer dollars paid for this other personnel cost. And I can tell you right now, 2 of them are part-time parks employees and myself that were there today besides one of my new hires, George Dust, and one of my paramedics himself now. So that is what Parks and Rec and the fire department are doing for the next 2 weeks.
Were those kids local?
All of them are local.
Nice. Good
All
job.
of them are here.
Good job.
Thank you, Chief. Zach, did you have anything for us? Councilman Adams?
I personally think the kids in our city would deserve some taxpayer money spent on them, so I have no concerns with that whatsoever. And so go on record of that, the kids in the future are worth any, or not any, but a significant amount of taxpayer dollars invested in the future of our city. So, so when did the train stop blowing their whistle?
I don't think they have.
Well, when do they?
Everything's passed.
Yeah.
When
Yeah.
everything's
I know.
passed.
Yeah.
Right.
So once it's all completed, then the railroad will come back and assess and then make a determination if it'll be a plat.
Oh, we.
They have a final say on the plat.
Okay.
But you first have to submit a set of plans that they say, yes, if you did all these things, that would make it eligible to be a plat. Then you have to go make all the improvements, and then they decide
That does not
if
shock me
that
at all.
does make it a plat. It's just the process. I would expect, maybe end of the year. I don't know how long after the work is done that the railroad kind of does its final sign. So I would not
If
expect.
that dump truck don't quit driving across, they'll never stop it.
So how do we plan on distributing all the COVID tests that we're going to get that we talked about tonight? How do we normally distribute our COVID tests among the citizens of our city?
From the public health side, it's been ran by the public health department. When they did a clinic over here at the community center, that was it. Other than that, residents of the city have to go to a test site or to the UG to have tests done. Now, within the city, for city staff, we have been conducting tests that take the lab for city employees.
For employees.
For employees only. But as far as mass testing for the community, that is still all ran through Stonington and down there. And the only time they've had any type of mass testing went out to the community center at one time. I think they did MWI or one of those plants. They didn't even tell us about it. They had done that.
So they didn't leave 10 cases behind for us to distribute to our citizens?
No, I'd have to double check, but I do think that the elementary school has had some that they're distributing. And if not them, I know that the school district has been involved in it, as well as the Bonner Springs Library. That's as local of an example as I can give you right now.
We don't have any access here.
sort of ask for.
How are they distributing all the ones in the rest of the county?
You have to show up to one of their sites. That's just plain and simple. If you go on to the health department site, they're gonna tell you if you need tests, you can report to one of these 10 or 12 locations. Go from there, for that. My recommendation would be do not put that on city staff to run. We offer them the capability to come in and do it for the community
Right.
center. And give them the access to it to do it. But from our side of the standpoint, we cannot dedicate staff hours because I can't even dedicate staff hours to say I can cover everything else. And most people who come in and ask us, we're sending the guy to the health department or to the school they have, but everybody just thinks that every fire station's got to be done.
Okay. And any ideas on how we market to our businesses, the ESL program you was talking about for employees?
I would say probably through Wyandotte EDC. There's a business retention specialist, Monica,
Mhm.
who is assigned to Edwardsville. So she's reaching out to our businesses on a regular basis. We do the formal roundtable, but I mean, she contacts businesses all the time. That's part of their job. Do you need anything? What's going on? Are you going to be expanding, contracting, adding people, training things that you need? So I would say that would be the number one.
So is this presently in her quiver?
I don't know. I wrote that down. How does this ESL program, if somebody wants them, they said nobody's here, but I don't know that anybody was aware of it.
Right.
Requested it. My guess would be nobody was aware of it.
I would think there'd be some businesses in town that would want to take advantage of that. When they mentioned about the health department and basically all of it is inside 635, practically speaking, when we're talking about our goals in the future and building needs and so forth, it might be kind of nice to see if we can't get Swope or somebody else to partner with us and maybe have a portion of the new building or the fire station converted into something where a part of it could be used for a health clinic on a regular basis to serve Western Wyandotte County. Unique concept, but I know it's revolutionary. So that might be something to put into our plans for the future. Some kind of a health services component to our planning.
We had talked, not about health service, but we had talked about, is there opportunities to provide some service that I need and I need to kind of take care of, EPU or water or something like that, or motor vehicles, or, did we make space available, design something where there's space available to be used by other entities, whatever that may be. I think it is a thing. We have a lot of population that lives right here that is somewhat dependent on walking or limited access to get to it. I mean, there's no way they can. It's very difficult for them to go do something, a change that they have to go down. It's difficult enough for us to get motor vehicle tags.
Right.
That's like send somebody and they're gone for 2 or 3 hours. I mean, literally. So if we can expand the service level, we can use the facility. I think that's something we should.
Yeah, that'd be great. I think that's all I have.
Councilman Bishop?
Mike, the building on 98th and K32, the northwest corner.
Yes, sir.
Let's condemn that. That thing is falling off into the creek. I mean, it's in terrible shape. I mean, you got a tarp covering part of the roof, so water's getting in there, and it's an eyesore.
Good portion is in the good portion of that property is flooded away.
Yeah. I'd hate to see some kids playing around in there and get in there and get hurt. You know, it's summertime and boys do what they do, you know? So,
Take a look at it, as you know, there's a process for that.
I understand. But if we get it rolling, maybe they, something, I don't know, that's just an awful place. And hey, when we were doing 4th Street, why didn't we go clear up to didn't do the apron of 4th Street right up to K32 when they did the repaving?
It's concrete
Right.
1 and 2, it's in KDOT right.
No, you don't need to say anymore, dude.
We went up to the right.
Yeah, all right. Thanks.
You done?
Yes,
Councilman Malat?
you're done too. He used all yours.
He got my train whistle and he took the whistle away from me. I was gonna ask a Swartz Road update. It looked, is the BPU part done? I drove it today and it looked like it might be finished.
They were, last I spoke to them, it's been about a week, they were finalizing some of their final connections and testing. So I need to follow up where they're at. I have a meeting on Wednesday with the contractor who's awarded the bid, which is McEnany Construction. So we'll have a meeting here, I think it's Wednesday morning to kind of lay out. We've got their bonds, we've got their contract. Let the date start, what are you doing, where we're going.
You think soon? Like
Pre-construction.
month, 2 months?
I don't, that's the part I don't know what their schedule is where,
Okay, just
if this
curious.
is something they're gonna get right on in 2 weeks, or
Yeah,
they've
okay.
got scheduled later in the fall.
Councilman Adams took away my silent. I was gonna try and get an update on the silent crossings, but I think I heard what I didn't want to hear. They need to sweep it when they're done with it, sweep it and fix it where it's going to the tracks and you got the bumps in it.
They're aware of those items. I'm not sure why they didn't finish striping.
I think we should have some parking stripes put in front of the Rural 32 because they park funny.
Have stop lines, have the divider lines, parking lines. They have a bunch of stuff that did do those.
I did want to comment on I don't know, the health department being here. I guess I appreciated them being here. I never knew the things that they offered. And I think if you went out here and talked to the citizens on the street, they'd go, what are you talking about? They provide their services. Well, why don't we know about that? And, maybe they should be scheduled. Maybe they need to give a bi-weekly report that could be put in the hot shot or something. Or Margaret said something about, what about mailers? BPU sends their mailers out all the time. Why can't they got $88 million or something? Couldn't they print some mailers and address them and send them out here to us? Anyway, that's just the disgusting part of it, working with the unified
I will
government.
say, I think that discussion, because he kept talking to me like he and I had some great discussion. I believe this originated was the mayor and I were asked, well, actually the mayor and the chief financial officer, so in this case, me, to meet with Mayor Garner and the chief financial officer and some people. And so a number of issues were raised around different things, saying, again, back to the question. So what things are being supported by the county and our community? I think I summarized for the mayor, so she correctly, but that was basically where it's at, which triggered then this discussion. And then quite honestly, we saw in the UG newsletter about the worker being in Bonner Spring, which did trigger me to send an email saying,
Well, they thought they were in Bonner Springs when they got here.
community health worker in Bonner Springs, why there? Then that
It's like the phase rating guy from Ottawa, when he did the streets. He said, oh yeah, the streets here in Ottawa are great. I mean, in Edwardsville are great. They send this and I don't know. I mean, I'm sorry, guys. I get disgusted with what goes on in there. I had something else. we got a new man working in, a new person working in public works. Can we start mowing some right of ways and some trees and use that articulated mower?
I don't
And
know.
knock our mirrors
He has
off.
more equipment experience than the other person, not have experience to do that.
I'm sorry, I was kind of ranting. And the other thing, I do want to make a comment on new public facility. I think I got to agree with Chuck and with Mr. Scott on the building because of conditions. We put $100,000 in a roof on this building. And we put in somewhere in the neighborhood of $50,000 on air conditioning on a community center. And if we keep having to do that, we could have had some pretty good payments made on new facilities. So I think that it's imperative that we start really getting serious about public facilities for our employees and for our taxpaying public. So that's my rant for the evening. Thank you.
Councilman
I had
Shriver.
to make one up because it took your train.
So, Chief Whittam, I think the program is outstanding. Outstanding. And I certainly haven't heard the concern, maybe if that's being used with taxpayer dollars, and certainly understand. I wouldn't have a problem with it either. Zach maybe can put something in the hot shot, massage the language stating this is sponsored by whatever the case may be. Hopefully that will explain it, because if there's a, sure.
Posting on it that shows the success of the program, when you have 16 slots and for one age group that fill up in less than 24 hours.
Right.
And you have another age group that filled up, you know, and then you sit there and have to bring in another, get the most age group out there. To me, that's where I think we're going to get it as far in, sit there and say, this is what it costs. This is how we funded this program for 3 weeks. This is our kids that were in this program. And that's just something we're trying to look at. As soon as I get done surviving 3 weeks. To put it all together.
And investing in our youth is just priceless. So,
Like I said, the number of young ladies that participate.
right.
When we look at this, we thought, well, we'll have a 50-50. More than likely, we'll have 70-30, but it's always a little fortunate to it. And when I got the roster and we're looking at, you know, 10 out of 16, and they're little ladies sitting there, and they have no problem getting in there, put the gear on, want to put the gear on and everything else today. I think that is setting not only the city up for success, but kids walking out today were like, so when we do this again next week, we'll know we're full of it. You know? And you only have one day of it. So I think when we started looking at this funding, how it had come up, I just think we got a few wrong words that are just there. And like I said,
Right.
I think myself-
Who don't know? Who don't know? Thank you so much. As far as the health department being out here, I think it was fantastic. The information, the programs. Unfortunately, I don't know how the communication has worked. I didn't want to put anybody on the spot, but I thought I had no idea about a few of these programs. I had no idea. And we should know. We're Wyandotte County. So I don't know who the health department communicates with. Do they communicate with a few people? I think it should be one contact person here, so they're getting the information they know Edwardsville wants. And I so far as to say, if Bonner has somebody for 8 hours a week, why can't we have somebody for 8 hours a week?
And that's actually where that started.
I hope you have a whole list of all our wants.
Yeah.
And all, I
No,
mean,
that's really where that started. I mean, I
right.
saw it in the UG newsletter about it, and I kind of got with Zach and, had we heard anything, and then we just did some follow-up. And again, did not realize that they were not a county employee.
Right.
And then it was, hey, let us get settled in and figure out where our schedule is, and then we'll see what we can do from there. And that was actually
Right.
a couple of months ago.
And I like Councilmember Adams' idea about a health facility maybe out here or some, they can put one out here. We can ask for that. We don't
We can
necessarily
rent
have,
them some space.
We could rent them some space. That could be a vision. As far as the quiet zone, yes, I do know that the horns are still going. When and if it all gets past inspection, I vote that we have a ribbon cutting ceremony and council member gets to cut it with the scissors. So you've led the brigade this far,
I want a
so.
horn.
You must wear a safety vest and a helmet 25 feet away from the ground line at all times.
Following the codes.
I'm gonna add some, the problem is now when that happens, there is a private crossing directly across from my house that is not gonna have silent crossing put in. But it is a gated crossing 90% of the time and they still blow their whistles there
But it will be included in the zone.
if the railroad decides.
And I've also heard that they can still blow their whistle. There could be an animal in the, there can be, right. It may not ever be silent, but.
And that's okay. They just don't need to wake up the neighborhood.
Right.
At 3 o'clock in the morning.
I will do some
With
follow-up.
fuel
I hate to
for
follow up
electric
with
cars.
Overall, but I'll do some follow-up, just what do they think the time frame is getting here to the end of the construction?
There's a house for sale up there.
Right.
We're gonna have to walk through those things. I've already seen they're gonna need it, correct?
There's a house for
And
sale
then
way away from
once
those
that's
things.
done,
Well,
you know,
I can't afford.
just what's that process?
Right.
I don't know that-
We still hear them up there,
And real quick about the city facilities, yes, long overdue,
especially in the winter.
very much needed. I totally agree with, let's see how much we can spend, how much we can afford, but like Chuck had said, keep the train going, same pace. I know we did a little bit of work. We were at a point. And I don't know if I remember this correctly, but I hope the two chiefs are involved with what we want, what makes sense. I think
what
they-
we have- What we have that's valuable is we did a space.
Right, I remember that.
That's solid. I think we're all in agreement that's the good piece of it. I think, and we didn't really invest much in.
Right, we,
Kind of design thing, and they put together some designs and put dollars to it. And I don't think that collectively, it's like, they hit on some of the concepts we were trying to get to, but not necessarily taking in some of the necessary details.
Right.
that we think would be important.
Right.
And so that's kind of, I
The
think our
delicate
sen-
details,
and-
right.
And then again, real says, so here's how many people we think we're gonna have at some point, right? Working for the city. And we built that into that base study, but I think then the question is, but at what, how much of those realistic or those 20 years out, right? Is that a year out job position or is that a 10 or 20? And is there a better way to plan for them? Maybe they're not even at city.
right,
Public Works is a classic example, right?
Right.
Is you may not have your public works director not be in common, but that's where they're at.
right.
So some of those kind of.
Well, we're going to own this building, so let's do it right.
We could have
Very nice.
somebody build it, lease it.
Right. That's all I have. Thank you.
Councilman Scott?
I'll be brief. I think, Mike, you talked a while back, a couple months ago about on the cities, on our asphalt roads, you do have kind of a priority list on roads and, ones that are going to be coming up, needing attention. I think if we could see that, I think that'd be good. I think it also would be good to prioritize, what we're thinking about, facilities for you guys and for operations or maintenance. And then at the same time, I want to make sure we try to add, or at least think about how the riverfront project, that fits into our plans for future. And then just try to prioritize these projects and I'm completely about trying to find the money, and I definitely want to know, if we go to 15% value, assessed value, how does that affect the citizens? How does that affect each one of us that live in the community? I think that's important for us to know, and our citizens to know that If it's an increase, they need to know. And if it is an increase, why is it an increase and what are we getting? I think we need to know that. So I agree with everybody on the council here tonight and just continue to move forward with those projects as it makes sense. And then secondly, I haven't heard anything lately about the VHC roads on the sewer project. Is that assessment about done?
It is, there was about 40 or 50 manholes roughly that scattered about. We were not able to get into, so James and his worker went out and got all those manholes opened up. Some of them were buried, had to be done.
Yeah.
And they were coming out to do the assessment on the final. I think it was around 40. Wow, I will follow up. I would hopefully within 60 days, we could be fully done. And then it's, what do we do next? Right. Part of that, just as far as ongoing maintenance, right? Cleaning lines, TVing lines, replacing lines.
Yeah, you're gonna have to
The whole variety.
priority list for them as well. So that's all I got.
Thank you. Oh gosh, let's see. Since we're noticing things in the UG newsletter and then thinking, hey, can that work for us? I noticed they have a new truck that fills in potholes, the UG. And so I was kind of wondering, is that a Kansas City, Kansas funded pothole filler, or is that a Wyandotte County pothole filler? And if it's funded by the county, shouldn't that benefit us in Edwardsville as well? So I was kind of hoping we could reach out to them and find out what funds were used for that and when we could schedule it here in Edwardsville.
We have, I will tell you, Shawnee came over, we used that patch. It does bear for pothole patch. I mean, what it does, it sprays it out, right, and it works okay. I mean, because it still has loose gravel. I mean, it does what it's supposed to do, which is shallow potholes, large, areas where we're kind of got large V-shaped areas, things like that. It works. It works quicker than a traditional pot pad. It's probably not as good. I mean, it certainly, clearly it is a short-term fix. Some cities like them, some cities don't like it. Generally, it's the public, because now there's this kind of tar gravel mixture and they don't like it. Right?
Sure.
So, but I will find out.
If we're paying for it, and if not, fine. But if we are, maybe get them on the schedule.
I will find out.
Another thing that's come up is a lot of Evergy trucks have been in the area with utility poles. Probably not going where you think on this. We have power lines all over the city on both sides of the road, crossing the street, and it kind of looks like a mess. I know some of our newer neighborhoods, Williamson Farms, doesn't have above ground lines, and I know it's really expensive to do underground lines. I'm hoping that moving forward in our future neighborhoods and developments that we'll have underground utilities. But is it possible when we have the companies here working that we can try to focus our power lines on one side of the road at least, so they're not a spider web all over the city?
Yes.
That would be really helpful.
So you brought a couple points up. I'll try to touch on them pretty quick. So in our subdivision ordinance, when we plat a new subdivision,
Those little towns
we're
are
going to be
pretty crazy.
updating our ordinance. So anything that's below a certain voltage,
Pretty much like having Edwardsville, where they make all their phone calls.
and both commercial, it requires us to go underground in a neighborhood.
Mr.
Right? Holes in the right of way, if we want those to go underground, holes to the city, we pay for the additional cost of that work. So the power company has authority to put poles up, wires up, right, by statute. And if we want it underground, and not necessary to be underground, then those fall onto us to do that. I will tell you the reason we're seeing a lot of Evergy and survey crews out there is they are looking at pathways for three-phase power to come out of their substation, existing substation, to go north and west, right? And so that's why you've seen survey crews out there. They're trying to figure out what that pathway is. There is no substation on the board being planned, haven't been filed in any local jurisdictions. So we got a number of calls about that. Why is the city now allowing the substation to be built? But we didn't allow it. There's no substation, nothing's filed with our planning department, no action before this body. But I mean, but we're not talking transmission lines, we're talking distribution lines, right? But for three-phase power. Now, I've had some brief discussions with them is, well, we're gonna already be redoing electric on 98th Street, right? Is there any way we can coordinate those efforts there as well as coordinate future efforts on Riverview? Because that's the path we're gonna go. Because we need three-phase power, as you know, to our lift station. I mean, so those are their pathways they're gonna go. I'd rather coordinate with them before they start putting poles anywhere. So we're very early on this kind of discussion.
Is it within our ability to, even though they can put poles up, to say we're gonna keep them on one side of the street instead of having them just willy-nilly everywhere in the city?
Probably a legal question. I don't know, we may need to explore that. I don't know how much say-so we have on. I will tell you, when we do road projects, new projects, we do a utility coordination meeting and we try to work those types of things out ahead of time. But a power company, Evergy is an example, they have certain statutory, I mean, they have the authority to use eminent domain for purposes of power systems. So they have some regulatory powers that we just don't have much control. That's why we can find ways, you know, if we need, in my opinion, if we need right of way, we know we're gonna need future right of way. Right? We know we're gonna need, and they're gonna go, they need to put power lines in. It makes a lot more sense to coordinate it right then. Because as I said earlier, if they go put a pole in and then we come along and drive the road and they cut their own easement, then we have to pay to relocate that power. And we don't want to do that when we can do that. And so that's even coordinating. If we know we got projects coming up, think are gonna come up, one of these things, makes a lot more sense to try to work with them. Again, so you can also say, hey, we want to keep, you know, we want to keep these power poles over here. Now, if they got to provide a service, right, they may have a pole go across the street and get around. Say it's a new subdivision example, right? Poles on that side, they got to get 80 or 100 feet across the road. They're probably going to go overhead and go off the ground, but not poles down both sides.
Right, and that's what we have in the majority is poles down both sides of the road, wires everywhere. And so maybe we could just look into that and say, if we're giving them right of way to access what they need to, if we have any limitations at all, and if not, if we need to look at pilot or whatever, so that they're paying for us to put it underground in the future.
The other challenge is, like out in front of our house, I've talked to them about it. We have a KCP&L pole KCP&L pole. We have an AT&T pole, and we have a cable pole. And they don't interact with each other, and they won't allow each other on their pole. And so that's part of the problem too.
Wow, that's ridiculous.
That is correct. Some poles, not all poles are owned by a power company.
Right. And so it might be in our agreements with them that we work something into future planning to make improvements. That might come in the future.
Working with them, we have to be very careful that we're not doing something that gives them more cost. We can't really evaluate whether they're being reasonable or not. A lot of those things have been taken away from the city. We have a little bit of aesthetics that we can talk about, but really not so much in the placement of poles. We have to do more with the accessories that come with the poles sometimes. And then we essentially absolutely cannot put in requirements that pretty much disallow them from doing their job.
Right, it's infrastructure.
So it's a fine back and forth kind of line dance. It's easier to do it on the front. It's harder when they're coming into this.
Right.
and they at right away.
So let's for sure for 98th Street.
Sure.
Since we're doing that, and then policy in the future for any new. And we can dive into it further. I just thought I'd put it on the radar since I saw the crews out and
And I
about.
think it's reasonable if we think it's some sort of safety issue or something like that, that we can certainly ask them about it with that, but it's not a lot we can do.
Let's see. That off the list. That last Friday, I know Zach was down there, Parks and Rec. We had a great movie night at the community center. A lot of folks turned out again. The weather was great. There were ICs. It was a great event, great summer event for kids and just people in the community come out too. So I wanted to thank those folks for having a great event. Codes was brought up tonight with some buildings and dilapidated structures in our city. And I know we have not a new codes officer. He's been around a little while. Heard he's doing a great job. Just thought maybe we could hear from either that particular officer or have a codes presentation in the next couple of meetings to hear what their goals are, what they're working toward, what our policies are, just to kind of get freshened up on that and who to contact for things. That sort of presentation would be cool to have in the next month or so. And lastly, last Saturday we had an Edwardsville mobile pantry event. We were having record numbers of folks registering. I think with prices going up all over, it's really putting a burden on folks in our community. And so we had distributed over 10,600 pounds of food to over 500 people, including helping folks at our senior high rise, stocking up the local pantry. And we had just car after car after car show up of families that are in need in the area. And so I just wanted to thank the city for helping us out with that again. Great volunteers. We couldn't do it without them. Local church, even Price Chopper donates bags for us to put groceries in. So it's really a team effort. But just wanted to thank the folks that came out and helped with that. And that'll be up for tonight. Thank you.
Yeah, I was having a friend of mine. He's an engineer.